pain of that mother who does not sleep nights after nights after night because the kid is awake. And let's not judge them or put them down or belittle them. My dad always told me, झियो तू बाहर को जाउछु किंतु always remember तू कौन निजर देश पाई निजर state पाई तू कौन कर पारिबो. I think this is a huge opportunity now that has come to me through this platform to reach to my people.
नमस्कार. आज रही आवासी बैठक जो माने जोग देइचंती समस्त को आमे स्वागत जनाउछु. कलिंग इतिहास रे हउची 32तम आवासी बैठक एवं साधारणतः कलिंग इतिहास रे आमे इतिहास संस्कृति एई भली विषय को नै कि आमे रखि थाउ हमर जो बैठक आलोचना रो विषय वस्तु रखि थाउ. किंतु आमे स्थिर करिछु जे मझरे मझरे जो ओडिया माने देश तथा विदेश रे विभिन्न इंस्पायरिंग पोजिशन को जाइचंती निज वृत्ति रे एवं सेमान को आमे ओडिया हिसाब रे हमर एई जो प्रयास रे आमे सेमान को डाकिबा सेमान को सुनिबा सेमान को कार्य विषय सुनिबा. एवं आज आमे एमिति गोटे विषय को बाछिचु जोटा कि गोटे समाज रो गोटे बहुत बड़ समस्या एवं ए समस्याटा एइतमै बेसी बड़ जे या विषय जेतिके सचेतनता आवश्यक सेतिके सचेतनता प्राय परिलक्षित हुए नाही एवं से जेतळे सचेतनता न थाए आकु आमे आउट ऑफ प्रोपोर्शन गोटे विराट प्रॉब्लम बोले आमे भाबि थाउ. से विषयटी हला जे एंगेजिंग ऑटिज्म एंड ऑक्युपेशनल थेरापिस्ट पर्सपेक्टिव. तो ऑटिज्म एबे एक बहु परिलक्षित घटना और या विषय जमती मु कहली आमर सचेतनता विशेष अभाव रही. तेणु ए विषय आज आमको सूचना देवाई आम सांगे अच्छा बबिता पट्टनायक. श्रीमती बबिता पट्टनायक सुदूर अमेरिका रे ए विषय दीर्घ 3 दशंधि धरी कार्यरत अच्छा. बबिता पट्टनायक मैडम आम आपण को आम कलिंग इतिहास संगोष्ठी तरफ माने स्वागत जनाऊँ एवं नमस्कार. मु तांकर संक्षिप्त परिचय देवाई चाहिए. बबिता पट्टनायक अमेरिका रे कार्यरत जड़े ऑक्युपेशनल थेरापिस्ट. विभिन्न परिस्थिति और पदपदवी यथा हॉस्पिटल इनपेशेंट, हॉस्पिटल इन आउटपेशेंट, नर्सिंग होम, असिस्टेड लिविंग, होम हेल्थ इत्यादि से दीर्घ 3 दशंधि धरी सेवा जोगाई आसुचंती. वर्तमान से प्री स्कूल हाई स्कूल स्तर पिलामानक सह काम करचंती. सेंसरी प्रोसेसिंग इश्यूज, हैंडराइटिंग, इमोशनल रेगुलेशन यही सब क्षेत्र में तांकर विशेष पारदर्शिता रही. से तांकर चिकित्सार जो प्रणाली से पंचभूत महाभूत प्रणाली आम निश्चित आपको शुणापी चाहिए से प्रणाली कौन पंचभूत महाभूत प्रणाली को काम लगे था. बबिता पट्टनायक बोधे जड़े पतंजलि योग शिक्षक, ईशा मेडिटेटर, एंटरप्रेन्योर, पॉडकास्टर, एंकर बहुविध प्रतिभा संपन्न होचंती. बबिता पट्टनायक बहुत सुखर विषय आज आम सांगे पाइचु. से आमको आज तांकर अभिज्ञता बांटे प्लस जो जो आज जो मैंने जॉइन करछंती एवं एई भली ऑटिज्म थिबा पिला मानकर जो पेरेंट माने जॉइन करछंती समानकर संगे से आलोचना करिवे. जदि आवश्यक पड़े आमे अनुरोध करिवु पेरेंट्स मानकु ए मीटिंग रो परे सी सीधा सड़क तांको सहित व्हाट्सएप माध्यम रे जोगाजोग रख करिवे एवं निजर समस्यार समाधान जहाँ कि यही जो टेलीमेडिसिन भली गोटे मीडिया रे जेते दूर संभव से तांकर ये करि परिवे माने परामर्श नहीं परिवे. तेबे मु अनुरोध करबी आज वक्ता श्रीमती बबिता पट्टनायक को से तांकर वक्तव्य उपस्थापन करिवे. मैडम आपनकर वक्तव्य उपस्थापन करत.
नमस्कार. नमस्कार एवरीवन. मो ना बबिता पट्टनायक जमती सुनील सर कहले. First of all, I really want to thank Sunil sir and my friend Preeta, जे कि मते encourage करले a talk ta dabaku. This is a huge platform and it's a very honor. It's a huge honor for me to be part of kalingahistory. Odisha ru asiki एठी US रे मु 30 years हला practice करूची. हमरो निजर कंपनी अछि. ता छड़ा मु प्राइवेट प्रैक्टिस करे आउ एबे रिसेंटली फुल टाइम स्कूल रे एंगेज्ड अछि. तो बहुत दिन मु देखी कि छुआ मानकर सेंसरी इश्यूज होची ता छड़ा ऑटिज्म I have always wondered being in US and when they have so many resources, how can I take this knowledge that I have gained for the past 30 years and do something for my state? So when I was approached, and I could not say no. I know we talk about Odisha and Kalinga history, but I think Odisha ru asiki jodi mu kichi bhi kari parli, kichi bhi in terms of sharing my knowledge, my experience, or giving professional advices, especially through telemedicine, I would definitely do that. And I think it's very honorable for me to be in this presentation. So engaging autism, an occupational therapist perspective. That is the topic. So I will be going between Odia and English because some of the professional verbiage that I'll be using would definitely be in English. କିନ୍ତୁ ମୁଁ ଚେଷ୍ଟା କରିବି କି ଯେତେ ସିମ୍ପଲ ୱେରେ ଆପଣମାନଙ୍କୁ ବୁଝେଇ ପାରେ ଏ ଜିନିଷଟା we do have a lot of awareness coming up now because ଯେତେବେଳେ ମୁଁ search କରୁଥିଲି when I was going through some of the information in Odisha, our government of Odisha has done a lot of work for awareness, but I don't think it is really again, it's a political issue, so I cannot make those statements, but I think, is this going to the right people? Are the parents being involved? Are the teachers aware of what's going on? Or as a general person, like for example, apana mu ame kon kari pariba for the society? Is this a trend that's going on? So ei sobo bishay nei ki ame just gote general vartalap kariba au seita hi mor goal ki at the end of the session I will be able to share some of the common sense approach to this huge problem, which is spreading like wildfire now. It is kind of, I try to explain people is the fact that jetole diabetes start ହେଇଥିଲା ସେମିତି ଲୋକମାନେ ଏତେ ଡରୁଥିଲେ କଣ ହବ କେମିତି ଆମେ we'll be on insulin, but there are so many things we can do lifestyle wise, food wise, exercise wise, early intervention wise. Same thing is going to be applicable in our kids with autism spectrum disorder, and especially ଯେବେ ଆଜି ଆମେ କଥା ହଉଛୁ engaging autism, that's what we are going to try to talk about and just discuss. Next slide, please. The people who are here who have kids with problems, they will probably be able to associate a lot. Kintu normally, dharantu mu chaluchi and hatat gote pathar mo padare bajila. So I'll move my leg up, and that's a normal reaction. But when we have kids in the autism spectrum disorder or with autism, you will see जोटा सर्कल करा जायछि on the left आपण जदि देखिबे they walk on the tippy toes पादटा तळे लगांतिनी आपण देखिबे से पिला मानकर काहे कि एमती होछि because they have lot of sensory issues that is happening and they are not able to put their feet down. So I always walk on my tippy toes. That's something which is very, very typical in little kids when they go to school, or even just when they are walking. If you want to think about, okay, moro chuara kona sensory issue achi. Yes, most definitely. So that is one of the signs you can see. They don't like clothes. Some kids will say they won't fit into clothes. Loose clothes they will not like, or if they cannot handle tight clothes. So they have a lot of sensitivity with the clothing. W sitting position, apan jati dekhitwe to the right, I'm just pointing to the right, is when a kid sits on the floor, semane godo dita bhangi ki emti basanti. तो आमे सबल को चौका मार के बसो माने cross, uncross your legs, sit in a cross-legged position. That's what I say here. किंतु आमे when we were growing up, आमा माँ माने की grandma माने सबल को थले चौका मार के बसो एमती बंका है कि बसनी गोड़ा दीटा को पूरा एमती W position. So that's something that is very typical because it talks about the tone of your body which is affected in autism. Then when there is loud noise, ଧରନ୍ତୁ ଗୋଟେ vacuum ଚଲଉଛନ୍ତି, so ପିଲାମାନେ ସେମିତି ହାତ କାନରେ ଏମିତି ହାତ ଦେଇକି ବସିବେ, or they'll go and hide somewhere because they cannot handle that. So if you are thinking about I'm overly sensitive to the loud sounds such as vacuums and blenders. And that is a very typical feature of kids with autism because they have auditory processing problems. ସେମାନେ जो noise टाକୁ ସେମାନେ process କରିପାରନ୍ତିନି ତାଙ୍କୁ ସେଟା ଲାଗେ कि बहुत जोरे କିଛି noise होची. So you will see them put their hands on your ears. Then if you ଗାଧେଇବାକୁ ନେବେ ତାଙ୍କୁ ସେମାନେ ବହୁତ ବ୍ୟସ୍ତ ହେଇଯାନ୍ତି ଯେତେବେଳେ ପାଣି ମୁଣ୍ଡ ଉପରେ ପଡେ. If you remember, all of us have gone through that phase ଯେତେବେଳେ ଆମେ ଛୋଟ ଥିଲୁ, because I still remember ପାଣି ପକେଇକି ମୁଣ୍ଡ ଧୋଇଲା ବେଳକୁ ବହୁତ ନିଜକୁ ଗୋଟେ କେମିତି ଗୋଟେ uncomfortable feeling ହଉଥିଲା. So sometimes when you put these kids in the water, they will not like swimming because that feeling of being underwater makes their sensation go very crazy inside. So this ଜିନିଷଟାକୁ ସେମାନେ process କରିପାରନ୍ତିନି. So ପାଣି ପକେଇକି ଗାଧେଇବା ଆପଣଙ୍କର ବହୁତ difficult ହବ ଛୁଆମାନେ. They won't like that. ତାପରେ କିଛି କିଛି ଖାଇବା, if there are certain food जोटा कि आमे समस्ते खाउछु हमको तारो स्मेलटा एते जଣା पड़ेनी किंतु ସେମାନେ ବହୁତ sensitive ହେଇ ପାରନ୍ତି. ଖାଇବା ପାଟିରେ ଜାକିକି ରଖନ୍ତି जोटा we talk about kids taking a long time to eat. ମାନେ ସେଇଟା ଗୋଟେ problem ଥାଏ ଛୁଆମାନଙ୍କର. So that is because they have sensory issues in their mouth, or they don't like the texture of the food. So these are few things. These are a lot of things that is there in the screen, but I would let you guys read it and then maybe come back with the question Q&A. But these are few signs that is very typical of all my kids that I see. Next slide, please. Okay, there is I would say that awareness of autism Odisha ebe badhilani, kintu it is not where it should be, and that's why we need a lot of awareness, a lot of talk like this, where people with experience can come and share. The general awareness that I have seen in people is the lack of it. Basically, ଆପଣ ଯଦି କାହାକୁ ପଚାରିବେ ଆପଣଙ୍କୁ autism ବିଷୟରେ କଣ ଜଣା, the first thing they will say, oh ଛୁଆ ମାନେ ବହୁତ ତାଙ୍କର behavioral issue ଅଛି, କି ସେମାନେ extremely genius, or parents ଙ୍କର କିଛି ଅସୁବିଧା ହେଇଛି ସେଇଥିପାଇଁ ହେଲା, or the parents are not good, they are not taking care of the kid, or they don't discipline them. So that is a general overview of a lay person who has not had an experience of having a kid with autism. They would say that, but actually it is a very challenging feature of the brain. Certain part of the brain, it becomes overly active, and certain part does not work like it should. So there is a lack of neuronal connection between every part of the brain, which makes it look different than the so-called normal that we have established. धरन्तु गोटे पिलाटा स्कूल को गला बसिलानी गोटे जगह ठीक रे. So for us, socially it's not acceptable because the kid has to sit down to study and the teacher has to have the attention of the kid. But se jinsota hei parni satole. Kintu seita for the teacher it's very difficult because the teacher is not going to sit, cannot tolerate a kid moving around. But if you think from the autism spectrum, the kid needs that feeling of getting up and moving. So that leads to motor issues. जोटा आपन को left side रे देखिबे लिखा है motor issues. So the kids will get up and move around. Communication and social struggles. They will not be able to say, suppose they are thirsty, suppose they are hungry, suppose they are hurting, तांकर pain होची कि तांकु भलो लागुनी किछि जिंस. So instead of, they will not have that communication skills that is a regular, like using words, using sentences. Seita tankara difficulty habo. Tankara dietary issues, which is a very important thing that we definitely need to discuss in this, is the fact that tankara milk intolerance हुए, wheat intolerance हुए, tankara bahut sara problems हुए, stomach constipation is a huge thing that we see. They will have leaky gut syndrome, जोठी कि तांकर जहाँ भी खाउचंदी खाइबा तो भलो खाउचंदी किंतु तांकर absorption of vitamins minerals है पानी. So dietary issues को नेकी भी तांकर बहुत सारा struggle हुए. तांकर masking हुए. Masking is a phenomena that even we do. For example, धरन्तु आपण गोटे ଗୋଟେ ଜିନିଷ ଆପଣଙ୍କୁ କୁହାଯାଇଛି and you are not very comfortable with that, but then you will try to mask and say you know. So the masking feature of a kid, especially in school system, जोड़ा मु देखे, से धरो ଗୋଟେ problem टा बुझी पानी, but he will act like he knows, and he will really not comprehend the problem, but then he will not know how to ask a question to the teacher for the help. So that also affects his learning. And masking is very, very typical in kids with autism who go to regular school. So more what a different I don't go to the special schools. We have special schools. In US, the special schools are basically for जो पूरा एकदम severe autistic kids सेमानका ପାଇଁ special schools अछि. But the moderate and the mild level रे जे पढुछंती तांको आमे regular school रे integrate करू. तांकर different classes हुए, but they get to interact with the regular kids, and that is what causes them to integrate into the society later on in life. So we'll come to that. Executive dysfunction. Okay, executive dysfunction होची जेतोळे आपनकर इमोशंस ऐड हुए, आपनकर माने गोटे परिस्थिति रे केमिति आपण एक्ट करिवे, like that is acceptable to the society. And you know, those executive function which requires a higher level, cortical level thinking, से जिनस गुड़ा affect हवो, and that is also because of a lot of predisposing conditions, which could be sensory, it could be perceptual. So से सब जिनस भी मैं बहुत सारा technical word use करची, but I will try to explain it to you later on. धरन्तु गुटे classroom रे, again I come back to the classroom. You have to sit and you have to listen and you have to answer back. से जो answer back टा process करके answer back टा आउ केमिति answer करबी with a certain tone of voice. So जेतोळे आपण छुआ मान को देखुचंती in the classroom and they scream out an answer, but it is very inappropriate in the classroom situation. So those are the executive functioning that gets affected because they don't have that little thing in the brain that says, okay, you have to use this tone in your voice in the classroom. So ए सब जिनस गुड़ा को बहुत and it's very interesting because you know, as an OT, we read a lot about brain functioning, and then neuroplasticity, जोटा कि मु कहवा को चाहूँची, जोटा कि it's such a positive thing with in the treatment process we do. Neuroplasticity ଯେତେବେଳେ ଆପଣ ବୁଝି ପାରିବେ brain କେମିତି ଏତେ ସୁନ୍ଦର ଭାବରେ, if you give them the right dosage of exercise, of sensory input, ए सब जिनस गुड़ाक ना आपनकर definitely help करिवो kids मानकु. But then you have to go to the right place, have the right kind of intervention. So another thing, apart from dietary, sleep. The first question when I ask a kid's mother for evaluation, dharantu mu clinic re dekhili, kimba school re dekhili, ki even on the phone when I do some consulting, first thing they say is chua khauni thik re, chua souni, rati sara souni. So sleep is a huge issue for our kids who fall into autism spectrum disorder or autism, especially autism kids mankara sleep disorder bahut hue. Then they have mental health disorders, which is anxiety, nervousness, irritability. Tapre processing, of course, jamti language. Semane buj ଆପଣ କିଛି ଗୋଟେ verbal command ଦେବେ, ସେ ବହିଟା ଟିକେ ନେଇକି ଆସେ. So he will understand that, he will go to the book, but he will not remember to process the rest of the part of what you said. And processing disorders are very, very common, but then again, there are different strategies to deal with that. Perfectionism, this is something I deal with. It is very, very interesting because there is a kid who would draw something, and if jadi say taro color pencil line palela from that border, that would make him very upset because he is into perfectionism. Now perfectionism can be at various levels. It can be geared towards a very good profession. dharantu apana robotic ro certain jinsa kale jothre pura perfection re kar paribe chua mane. So when they do that, the end product is fruitful for them. So then we use the concept of perfectionism to find a task which will enable them to do better and give them satisfaction, because perfectionism is very hard. You know, sometimes we label that and we say ki tame agents but the imperfection is also important to survive in the world. So again, that's another aspect that we can talk about later on. Next slide, please. Okay, these are some stats that we can look at. 1 in 36 kids have been identified with autism. They're boys, they are more prone to be diagnosed with autism than the girls, 4 times more. And then some areas, they have higher prevalence, like California, 1 in 26, and South Korea, 1 in 38. Sometimes I think the prevalence, this is my personal point of view, because mate lage ki wherever there are more resources, you find early detection hue, to maybe that is one of the reasons we find it in the prevalence in places where there are more testing, standardized testing that are done, or more awareness. And 1 in 100 children worldwide have been diagnosed with autism spectrum disorder. This is WHO 2019 fact sheet. I think that there are many more that you see in this slide. 3 million persons in India in the autism spectrum disorder. Kintu mate lage ki a number in India is actually, I mean, we would add more to this, because many places they have not been detected, and now hopefully we'll know more and more with so much awareness going on. So 1 in 1.5% of children aged 2 to 9 years are diagnosed with autism spectrum disorder. Actually, it's sad, because the sooner you get to know a kid has this condition, there is a time where the brain neuroplasticity बहुत active हुए. So the earlier we know, the better it is. So ସେଇଟା ହିଁ ଆମେ ଚେଷ୍ଟା କରୁଛୁ କି early intervention କରିବାକୁ, because it leads to a lot of expenditure, whether it's from the parents, from the government, from the schools, getting special eds, the kids' medical conditions that can cause a lot of expense. So as you've seen in the last part, there is the cost, the medical cost has tremendously increased because of this condition. Next slide, please. ଯେମିତି ଆମେ କଥା ହେଲେ, basically there are 3 levels. Just a second, I need to move this around so that I can see better. So ଆମେ ଯେମିତି କଥା ହେଲୁ କି autism ର motor difficulties, they have motor difficulties which involve running, walking, climbing down the stairs, playing in the playground, just getting down from the bed. Some of the kids are very scared. They don't want to get down from the bed. Seda hegala motor difficulties, like basically all the milestones, whether it's crawling, whether it's creeping, like army creeping, all of these things will lead them to be able to stand up against gravity and do things on their own. So जब motor difficulty हुए, तांको जदि गोटे छुआटा बसी पारनी ठीक रे, if their trunk balance is not there, आपण तांको जदि handwriting practice करबे, it is very difficult. So motor difficulties is very important when it comes to the intervention, especially as an occupational therapist. आमे बहुत सारा focus करू on the movement part. So when we correct their movement, when we correct their body alignment, their tone, their muscle, their ability to sit still, that helps to improve the distal control of their wrist, especially handwriting, jota ki darkar school re. Social impediments, jemti kahandi, especially this relates a lot to the family. Usually it's sad that the diagnosis is such a taboo. People don't have an answer as to कौन मोर छुआर जदि डायग्नोसिस हला तो मो छुआ माने को संगरे मो केमती इंटरैक्ट करबी socially, because people always look at a kid with the problem as if the questioning, and it's not the problem of the person who is looking at the kid, because they're not aware of this condition either. They don't know how to handle them. So parents one ko pai bahut difficult, especially the mother. And with all due respect to the fathers, the mothers spend a lot more time with the kids, and mothers man ko pai, apart from doing the normal chores, तांको ପାଇଁ ଏଇଟା ବହୁତ difficult ହେଇଯାଏ କି କେମିତି ତାଙ୍କର ବି life ଗୋଟେ normally କେମିତି lead କରିବେ. So the impediments becomes a lot, and the family as a whole, they have difficulties. So that's another aspect that we deal with when the kids fall into the autism spectrum disorders. They have sensitivity to different changes. For example, आपण घरे ରହିଲେ निज घरे गोटे certain disciplined way रे କରୁଛନ୍ତି. कार गोटे बाहागर हला एबे तो बाहागर season चालुथला. So you want to go to the marriage, and then the kid with the diagnosis of autism, they might not be able to handle all these noises, lights, different people, and then it becomes very embarrassing for the parents, and they really don't enjoy that, and they keep the kid at home. They try not to expose the kid, which is not even good for them, rather than using tools to handle how you can handle the kid, train yourself, or केमिति आमे निजको equip करिकी छुआटा को नेकी जिबा, and then there are ways of doing it, but then there is so much of sensitivity issues with so many things like sensory issues जोटा मु को जोटा रे आमे कथा होछु जदी noise, touch, smell, hearing, even movement, if they are moving, they're going somewhere, the new environment, it's just too much for the kids sometimes. The communication difficulties, yes, language, gestures केमती appropriate inappropriate gesture केमती करछन्ती सेटा गुटे बहुत significant जिंस आपण देखिबे. Repetitive behavior which also falls under stemming. Stemming गोटे एटा concept होची कि जोथरे आपण को body को दरकार move करिबा, or certain things like they'll flicker their ears, or they'll play with the hair, or they will just do something with the hand, or they'll take the pen, or जदि तांको हाथ रे उठे thread थिबो से बार बार they'll do that. But that is a behavior which is very, very appropriate for the kids because they seek that. Okay, so that repetitive behavior, which we say repetitive behavior, is actually a need for the kid. So jebe ame se jinsata buji pariba na, then as a society will be so much helpful for bringing up these kids in a positive manner. So I will keep saying that because that's the whole goal and the purpose of my talk today. So the levels jemti ame just discuss कले कि तांकु social interaction छुआ मान का संगरे खेलिबा difficult हबा same age छुआ मान का संगरे से मानकर जेहेतु से माने संग तांकर same age छुआ मान का संगरे खेली परिबेनी तांकर they are deprived of a lot of developmental skills that happens in the actual play. So that is level 1. जेतोला आपण second को जिबे से टिके substantially बेसी support दरकार हबा. Again, due to their very repetitive, restricted behavior, that makes them like stand out in a classroom, or they get in trouble. So their social interaction gets limited because of that. And then, of course, the third level where you need a lot of support. You need a person to be with that kid all the time for all the needs, ADL needs, माने गाधेबा, कपड़ा पिंधिबा, खुआइबा, सबु जिंसो पाई जणको गोटे caregiver दरकार. So that would be your third level. Next slide, please. So आमे as a therapist हमको सबले पचरा जाए कि मैम ए पिलाटार ए छुआटार एटा प्रॉब्लम अछि, आमे जाइथिलु थेरेपी रे तांको एमती ट्रीटमेंट करछन्ती, आम छुआ मान को काई कि आमे अलगा ट्रीटमेंट करछु. So that is the first. On the left, what you see is two autistic people are, they cannot be stereotyped. Ki eta a chuaro a diagnosis, suppose chuaro ADHD hela, to amuku eta gude prescription diyantu ki a jinso eta apply haba, same jinso out chuata ko with the same diagnosis haba, it doesn't apply. It is very, very, very subjective, very subjective. Secondly, apankara gharara environment kono, तांको केते exposure, छुआ मान को केते exposure मिलिछि, early intervention heiछि कि ना नाइ. There are so many things, and even in the brain, if you think about it, the brain works completely different for each and individual person. So जदि आम समस्त normal so called आमे जो normal आम निजको कहूँ आमे जदि different behave करछु, so why do we want to stereotype kids with ASDs? We should not. So they are very, very different. So they need very specific treatment goals and interventions. Other condition, comorbid conditions and autism. Usually you will have Jotamukochi autism spectrum disorders. Seizure is a very common, diagnosis that you see. They have anxieties. They have sleep issues. Jotamukoili, pretty much all the kids with ASD will have speech issues, sleep issues. Then they also have gut issues. Jadi आपण माने food विषय जदि किसी detail जानछंती, nowadays mainly the focus is gut health. ସେମାନେ କହୁଛନ୍ତି କି ଯଦି ଆମର ଓଡ଼ିଆ ମାନେ ଗ୍ରାଣ୍ଡମା ଆମର ଯୋଉ ଗ୍ରାଣ୍ଡମା ମାନେ କଥା ହୁଅନ୍ତି ଯେତେବେଳେ ଆମର ପେଟ ମାନେ ଯେତେବେଳେ ହେଡେକ୍ ହବ କହିବେ କି ତମର ପେଟରେ ପ୍ରୋବ୍ଲେମ ଅଛି ସେଇଥିପାଇଁ ତମର headache ହଉଛି. I never understood that, but now after so many years US ରେ ରହିଲା ପରେ ଏବେ ସବୁ ଜିନିଷ ପୁଣି gut health କୁ ଆସୁଛି. ଯଦି ଆପଣଙ୍କ ଛୁଆ ର problem ହେଇଛି, if the kid has not gone to the bathroom for 2 days, 3 days, ଆପଣ ତାକୁ ଜବରଦସ୍ତି ଖାଇବାକୁ ଦଉଛନ୍ତି, ତାକୁ ବସେଇକି ପଢେଇବାକୁ କହୁଛନ୍ତି, କ୍ଲାସ କୁ ପଠାଉଛନ୍ତି, therapy କୁ ପଠାଉଛନ୍ତି, they will have issues. So gut health is so important for all our kids who have autism or ASD. It is important for the kids who do not have that either, but that is linked to the behavioral problems, which is irritability, aggression, and all that. जोटा छुआ मानकर जो बिहेवियर हुए एंड तापाई भी बहुत सारा फूड रिलेटेड इश्यू अछि जोटा कि आउ किछि पर स्लाइड रे आसीबे आउ overweight and obesity, that is again, it is spreading like wildfire now. We are seeing a lot of kids due to the lack of movement, and the lack of movement is not because they don't want to, it is because they have the sensory issue that prevents them from moving. They have obesity issues because we are getting so many outside food. ଆମେ ଖାଇବାକୁ ଦଉଛୁ ଘରେ cooking ବହୁତ କମି ଯାଇଛି ଆଜିକାଲି ମୁଁ ଦେଖୁଛି ମୁଁ ଯାଇଥିଲି ଏବେ recently ଓଡ଼ିଶାରେ. It's well and good to have good food from outside occasionally, but since I do yoga and meditation, ମୁଁ ବହୁତ ଜିନିଷ ସାତ୍विକ ଖାଇବା, ନିଜେ ବନେଇକି ଖାଇବା, no frozen food, occasionally going out and eating, food with all these preservative sauce, ketchup. I think that is something that causes problems. Okay, so when we talk of neurodiversity, okay, so rather than giving them a particular diagnosis, now we need to talk about what is neurodiverse. Neurodiverse re ama brain ta certain way re kama kareni. Certain part of the brain becomes more active, so you will see some signs which are more predominant, but the other things might not work. So for example, ADHD, ଆପଣଙ୍କର dyslexia, ସେମାନେ ପଢି ପାରନ୍ତିନି କାହିଁକି ନା ତାଙ୍କର visually ସେମାନଙ୍କୁ letter B ଆଉ D ରେ differentiate କରିପାରିବେନି, ଉପର ତଳ ଦେଖିପାରିବେ, ମାନେ ସେମାନଙ୍କୁ ଲାଗେ ସେମାନେ ପଢିଲା ବେଳକୁ ତାଙ୍କୁ letters ଗୁଡାକ ସବୁ ଉପର ତଳ, ମାନେ it will start floating. So ଯଦି ଆପଣ ଦେଖିଥିବେ ତାରେ ଜମି पे ଯଦି ମୁଭିଟା ଦେଖିଥିବେ ସେ ଛୁଆଟା ଦେଖୁଛି screen ରେ, he starts seeing the letter moving around, and that is a visual perceptual issue that happens with these kids. So that is a neurodiverse condition. They are a little bit different. It doesn't mean they have issues that cannot be fixed. With proper intervention, it can be fixed, but we have to identify that this kid is falling under the neurodiverse spectrum. Dysgraphia, intellectual disability, OCD, ମାନେ ସେଇ ଗୋଟେ ଗୋଟେ ଜିନିଷ ବାର ସେମାନେ କରୁଥିବେ, anxiety, depression, autism जो विषय ଆମେ ଆଜି କଥା ହଉଛୁ, ଯୋଉଟା କି ମୁଁ relate କରୁଛି. So neurodivergence is a very good word as opposed to saying my kid has ADHD or autism. Neurodiverse means our brain is functioning in a different level that we don't understand. So I think the problem is us as a society. Are we understanding what the kid is having issues with? So that is what neurodivergence is, and it is very powerful word. It gives them it takes away the label that we have on this left side. We have so many issues. Instead of labeling them, their brain is working at a different level, and that's what we need to go and figure out. What is that level? How do we go to that level of the kid's brain and analyze and bring them back to what would be acceptable in the society? A simple example is, are they able to sit in the classroom and listen and understand what's going on the board? So that is the huge goal for me as a therapist. So neurodivergence, instead of using, if from this class that we have, or the presentation that we have, if we can take one word, I would request all of you guys to start using neurodivergence. It's a very acceptable word. It just says that ମୁଁ ଟିକେ different, କିନ୍ତୁ ମୋର strength ଅଛି. I don't have weakness, I have strength. I don't label my weakness, I have my strength. I want to identify my strength. I want people to accept me of my strength and respect me and include me in the society and just work with me. So that is what neurodivergence is. Occupational therapist, mate sabu ajikali the school system re, even in Odisha, in India, we all have started knowing about occupational therapy, and it is being accepted in a pediatric world. Ebe mo pediatric setting re kamo karchi, kintu amaro scope of practice has been like everywhere. Geriatrics, like when you talk about 75 to 100, that age range, nursing home re rahanti lokomane tankara neurological orthopedic conditions, sethire ame sabu contribute karu. Ame activities of daily living, functional activities ame karu, jothre ki semane au thre nijoro independence dharantu khaiba banebe. You know, it is a simple thing, kintu khaiba baneba pai various level of intellectual balance, your sensory, all that information, you know, it has to be coordinated. And we as occupational therapists, we do an assessment, and then we find the problems, we address that. And 8A, even in India, people are trying to live independently as long as they can. They don't want to be dependent on anybody. So to promote that functional independence, we have to work towards their strength. And I'm sorry, I think, can we switch back to the previous one? Okay. And then we do hand therapy, jo thare hatara conditions, carpal tunnel, sora sabo karu ame. Neuro rehab, jatore brain injury hue, stroke hue, se thare ame kamo karu. Acute rehab, hospitalizations जोड़ हुए जो जारो operation हुए, different condition. COVID रे आमे बहुत participate करथिलु तांकर lung function improve करिबाकू in order to be independent. Mental health रे भी हमर anxiety, depression सब रे आमे बहुत कामो करू through activities. So yeah, let's go to the next slide. Thank you. Okay, here comes the main part: occupational therapy intervention for children diagnosed with autism spectrum disorder. The most interesting part of my work is when I work in early intervention, 0 to 3 years. 0 to 1 year is when all the milestones are developing. Like from being able to just laying flat to standing up and walking, say 12 months. Sethire, jadi ame early intervention kariparu, suppose dharantu kids have problems, they have tankara maankara kono pregnancy issue thila, they had to be in NICU, which is neonatal intensive care unit re thile, ki hospital re thile. Jatore se sobo situation tankara jo birth history ra ame pau, ଆଉ ଯଦି ଆମେ early intervention କରିପାରୁ, within a few months, once they get into that level of milestone, ଧରନ୍ତୁ ତାଙ୍କୁ 6 ମାସ 7 ମାସରେ ବସିବାକୁ ପଡ଼ିବ, if they are not able to sit, then ତାଙ୍କର ବାକି ସବୁ milestones delay ହେଇଯିବ. So early intervention is the main thing that we can change the neuroplasticity of the brain, and that is what we need to work on. Kete sigra hame identify kar pariba. And occupational therapist intervention is amazing when it comes to early intervention. That is where we deal with milestones, we deal with sensory issues, we deal with their trunk, their balance, their motor abilities. बहुत सारे जिनसे हमें early intervention रे करू. School-based intervention. Now, school-based intervention is very interesting because here our goals are basically आपनकर सोशियो इमोशनल माने केमती से पिला माने बिहेव करचंती, क्लासरूम रे केमती बिहेव करचंती, प्ले एक्टिविटी रे करचंती कि ना नाही, how are they interacting with the teacher? Are they listening? Are they able to sit still? So that is a very challenging yet very rewarding experience when I work in a school-based situation. And we go to normal school, we go to special schools, we go to the third part, which is the clinic-based intervention. जो थे कि आमे माने birth through 18 years, even adults. तांको आमे देखू, तांको clinic रे 1-to-1, we see them for 45 minutes to an hour, even 30 minutes, depending on what their need is. And we address all their problems, which we get from the assessments. Next slide, please. Excuse me. Occupational therapy intervention, eta hochi this is one of the most important things that as a parent you should ask. आपण जो छुआ मन को नेकी जाउछंती क्लिनिक्स को कि थेरेपी क्लिनिक्स को कि स्पेशल प्लेसेस को स्पेशल स्कूल्स को सेठी आपण जे थेरेपिस्ट माने काम करछंती तांको आपण पचारिबे कि आपणकर कोन मोडालिटी आपण यूज करछंती. So there are two things which I use. Apart from other stuff, I would work on the reflex integration, sensory integration. ଏ ଜିନିଷଟା ମୁଁ ଟିକେ ବୁଝେଇ ଦଉଛି, ମାନେ it is very technical, but I will try to use normal things to make it explain for people who are not used to the verbiage. So reflex integration ହେଲା ଆମର ଛୁଆ ମାନଙ୍କର ଯେତେବେଳେ ଜନ୍ମ ହୁଅନ୍ତି, actually before birth there are reflexes that Mother Nature has given them in order to have them birth. When we have the birthing, there are different reflexes that the babies need, and they survive in order to survive in the womb of the mother. So maankara petare jetole se bodo hochundi, there are different reflexes that help them to survive, because birthing is very hard even for the babies. Semanku gote environment re jo bodo hochundi setole bhagwan gote emiti kar dei mane deichundi reflexes that is protecting them to grow to the optimal level in the womb. So that is what the actual definition of reflexes. It is used for the survival of the baby, and then when they come out, so from birth to 1 year, these reflexes should integrate mane सेटा होची से जो से ब्रेन टा से रिफ्लेक्सेस गुडा भूली की नुआ मूवमेंट गुडा को सिखिबो. Okay, so couple of reflexes, just example दोची आपनकर first reflex is rooting. एटे जदि छुआ को टच करिवे जो जन्म छुआ 3 मास 0 to 3 months जतळे 0-2 months रु जतळे आपण टच करिवे से छुआटा सेपट मोहटा will go towards the where your finger is stroking. Now why do we use this? जतळे छुआ माने जन्म होंती, they have to turn to the mother when they are feeding, when they are nursing or breastfeeding, semanku muhota turn kariyaku padibo. So God has given that's a God gifted thing. So semane dhire kina turn karibe. Now when you have a baby who has issues during birth, tanku tube feeding hechi, semane se jo breastfeeding kari pari nahanti, that reflex will be there. That reflex has not had time to integrate. So kona hue sethire tankara सेमानकर feeding difficulties हुए, तांकर swallowing problem हुए, तांकर कथा कहबार problem हुए. So it is very, very important to understand as a therapist and as a parent what is reflex integration. So whoever is here today, I would definitely like you to go to the net or just connect with me. I would give you, that's a totally different, very technical, very therapy related term. किंतु आपण मान को समस्त को जानिया पड़ियो कि बहुत सारा reflexes थाए जोड़ा कि बर्थिंग रे यूज करें 0 to 12 months जो हमारो छुआ मानकर माइलस्टोन्स हुए सेथरे डेवलप हुए, किंतु जदी से गुडा को रिटेन रही गला ड्यू टू एनी रीजन, इट कुड बी ड्यूरिंग प्रेगनेंसी छुआ माने मांकर ब्लड प्रेशर हाई थिला, दैट इज कॉल्ड प्री एक्लैम्पशिया, से कंडीशन हे पारे. इट कुड बी बिकॉज तांकर थ्रू डिलीवरी जदी cord is wrapped around the neck of the kid and the blue baby कहते हमें, which my son had that problem too, but then he recovered. Being a OT mom, I worked on his milestones. So एगुड़ा सब बहुत सारा विभिन्न प्रकार रो reason अच्छी, during pregnancy, at birth, after pregnancy, and from 0 to 3 years, when they might have some kind of like say meningitis ହେଇପାରେ, କିଛି ବି condition ହେଇପାରେ that can cause all these reflexes to retain. So ଆମେ କ'ଣ କରୁ as a therapist, first we do an assessment, find out where the kid is on these reflexes. Once we find those reflexes, ସେଇ reflexes ରେ ଆମେ କାମ କରୁ, କାରଣ reflexes ଗୁଡାକ ଆପଣଙ୍କର spinal cord level ରେ ଥାଏ, ଆପଣଙ୍କ ଯୋଉ brain ରେ ଯୋଉ ଆପଣଙ୍କର executive functioning, where you have to think, you have to plan, you have to organize, ଏଗୁଡା ସବୁ ଜିନିଷ ଯୋଉଟା ଦରକାର ସେଇଟା ଆପଣଙ୍କର frontal ରେ ହୁଏ, ମାନେ frontal lobe ରେ ହୁଏ, which is again it's part of the brain, which I'm not going to go into that. But ଯଦି ଆମେ ଏଇ reflexes ଗୁଡାକ ଯଦି ରହି ଯାଇଛି ଆପଣଙ୍କ brain ଆପଣଙ୍କ spinal cord level ରେ, ଆଉ ସେଇଟା ଯାଇନି ଉପର level କୁ, cortical level କୁ, ଆପଣ ଯାହା ବି କରନ୍ତୁ ଛୁଆକୁ, the kid is not going to be able to progress. So that is the beauty of reflex integration intervention for occupational therapist. So maybe if I get a chance, I might do this in another session, because it's a huge thing. ସେଟାକୁ ବହୁତ ଜାଣିବାକୁ ପଡିବ. We have 6 major reflexes that we check for kids who have issues in school. So maybe they will walk, they will try to talk, but then they cannot do executive functioning as learning new things. They will have problems with mathematics. They will have problem with logic. They will have problem with problem solving, reading paragraphs. So seta not only in the severe or moderate autistic kids रे आमे देखिवा, आमे ए सब जिंसो we will also see in normal kids, the so-called that we label them normal, but they are neurodivergent. जोड़ा आपनको मु कहया को चाहूँ, use the word neurodivergence, because their brain is not processing at that level. So when we do the reflex integration, immediately you see the change. Chua mane je katha ko nandi, earlier I had a speaker, I had a participant who was talking to me about this. So if I get a chance to work with the kid and we do some reflex integration, I will check which reflexes are there, are retained, seta jaini. Say jinso upare ame as a therapist ame work karu, all of a sudden you'll start kids talking. Okay, I'm not going to deviate from, I usually go off the tangent. So Preeta has given me like time limit, Guru Day, you know, I want to stay to the time. Now, second is sensory integration. What is sensory integration? Jodi ame bujhi pariba, tahale ame autism, the kids with autism ko bahut respect kariba, tamu include kariba. Okay, so dharantu, I want to always give example because that's how it stays with me. And, you know, I learned from a good teacher. So what a good example there. ଧରନ୍ତୁ ଆପଣ ମାନେ, like for example, let me put myself in this picture. ମୁଁ ଯୋଉ first US କୁ ଆସିଲି, ଏଠିକୁ ଆସିଲି. So first ଆସିଲି ଯେତେବେଳେ ତାଙ୍କର accent, ହଠାତ୍ ମୁଁ ମୋର କାନରେ ତାଙ୍କ accent ଗୁଡାକ ପଡିଲା, କିଛି ବୁଝି ପାରିଲିନି ସେମାନେ କେମିତି କଥା ହଉଛନ୍ତି. Then second thing, driving. ମୁଁ ସେଇଠି ସ୍କୁଟି ଚଲଉଥିଲି, so I was driving on the other side of the road, ଏଇଠି right side ରେ drive କରୁଛି. So my brain was like, okay, when I turn left, I have to turn a certain way here, then I turned there. So that was one. Then visually, there was so much greenery. When amko to eti drive kare pade nije nije. So when I used to drive on a straight line for a long period of time, mate bahut nido laguthila, kintu as a new therapist, we had to drive like an hour to go and work. So that was like too much, you know, that was stressful. Emte bibhinna prakar yere karikina, like the first 3 months was very hard, learning how to write documentation, learning the new way of dressing, how to be dressed appropriately in this new world. Kintu, jehetu we fall under the so-called neurotypical person, it took me 6 months, but finally I learned to drive. I learned to talk, but my accent will never change. I grew up there, so I tried to speak slowly so that they could understand me. And I was very careful in listening what they are saying, so I could comprehend their speech and understand. So amana dekhuchanti amara brain kemti connection banochi even for neurotypical people. So now let's take a kid with the problem. Jadi se gute, you know, for me, it took me 6 months, okay? And then my brain got accustomed and I learned new, and then my brain made new connection. So for example, I have a kid with this problem, with this particular predisposing factor. And then the kid goes to a school, there are like multiple noises coming in from different directions. কিন্তু তার লেভেল তার जो reflex টা integrate ହେଇନି, তো তার जो ଉପର level ର जो connection ଟା ହେଇପାରୁନି. So then he's still there. He's still feeling those noises. He's still feeling the sensations that makes him jittery. He just wants to get up and move. So that is what is called as sensory integration. So ame kon karu for the intervention aspect, what we do is we give them sensations. There are 8 type of sensory sensory input that we get. Gote hala movement, that like it, I can list it out. I'm not going to go through in detail. Kintu 5 primary sensations, jota touch, smell, hearing, vision. I'm missing one. And then the other one is I should have that. There is the one that we use for therapy is basically apankara hela vestibular, the movement, proprioception, joda is joint ro sensation, interoception. Interoception eta gote new thing jetole apanku bhokko laguchi, apan bhituru kichi gote jinsada apanku cue karuchi, so then you say I'm hungry. Okay, for our kids, all these 8 sensation, there is a little bit of off of how your brain perceives. Gote sensation asuchi, किंतु से सेंसेशन टा बहुत मैग्नीट्यूड बहुत बढ़ी जाउची हम ब्रेन रे, आ से माने से जिंसडा को प्रोसेस कर पानंते काहे कि ना तांकर जो कनेक्शन टा ठीक रे हे पाने. So with sensory integration techniques, we grade the sensation, धीरे धीरे तांको आमे एक्सपोज करके धीरे धीरे सेटा चैलेंज गुडा को बढ़े बढ़े की तांको एमिति लेवल रे पहुंचो जोठार की they become neurotypical. Okay, next slide please. Okay, here are a few things जो थी कि मोरो एबे मो पाई, you know, I work in this Western world with different protocols and this and that, but to me, since I'm a yoga practitioner, I have started making connection with what we did. I'm बहुत thousands of years ago I'm going try to bring that into my therapy sessions, and it works. पांचटा तत्व अच्छी आपने जानी चंती जो अर्थ रो तत्व, sky, akash, then you have fire element in your body. मन पके के कोई होगा मतलब difficult होची, किंतु anyway 5 तत्व that we have.
ताप, तेज, मरुत, वायु.
Okay, vayu, yes. So एबे मु कोन करे से जो वो concept गुड़ा को मु use करे in my therapy sessions. So for example, धरन्तु earth element, right? Earth element, if you have done yoga, आपण जानि परिवे आपणकर groundedness कहंती. Groundedness जो थरे खाली पादरे चालंती ग्रास ऊपर, आमे सब बेले एडा जो देखुचंती खाली पादरे जो ग्रास रे चालुचंती, पत्थर ऊपर चालुचंती, regular cemented floor upare chalchunti. It's very unfortunate आजिकली छुआ माने धूली मुळई हेउनांती, because when we grew up we were doing a lot of जो धूली रे खेलिबा, हाथ रे धूली लगेबा, देह सारा माटी पड़की जो पिठू खेलथुलो आमे, मते मन अछि जो बॉल रे मार के पिठू खेलथुलो सेतळे दौड़ दौड़ की जाय की you know, you fall on the floor, on the ground. So जो groundedness टा जोटा कि हमरो earth element, it is very very important. So आमे कोन like in real life what we can do, तांको चका पीड़ा मारी की फ्लोर रे बसे की खुआइबा, take the table out of your house, माने dining table रे गोड़ो झुलुची, हाथो हलुची, you know, if you make them sit cross legged on the floor, immediately आपण को देखिबे से मानकर concentration to hand to mouth will improve. So that is one of the most important tattva I use for my therapy. Secondly, आपणकर वायु जोटा कहिले वायु रो the air element. जेतोळे आमे breathing exercises करू, okay, you're doing exhaling, inhaling, जेतोळे lungs को expand करू, आपण जेतोळे exhale करंती, a lot of things happen in your system. Your जो आम kids मानकर तांकर sympathetic system is very very overactive. Sympathetic system टा कोन जो थरे आपनकर fear, anxiety ए सब जिंस सब बळे हाइपर हेकी थाए. So जेतोळे आपण तांको बसे देबे गोटे धरंतु चक्का मार के बसेले तांको कहले breathing, let's focus on your breathing, and I do that with my kids in US. तांको I just have them take off their shoes and socks, cross-legged position, and just say a, u, ma. So these three words, a, u, ma, does not require your tongue to move in your mouth. एटा आपण दुनिया रे कोठी भी पिला मान को करे दियंतु यूएस हो सिंगापुर हो, इट डजंट मैटर, जेबे से तीनटा वर्ड कहबे तांकर जे एक्सहेलेशन हबो से एयर एलिमेंट एक्टिवेट हबो, आपण को वेगस नर्व which goes from the gut to the brain, that gets activated. So when that gets activated, your parasympathetic system gets into action, so they relax. Now, when they relax, the fear, the anxiety, the frustration, everything goes away, your concentration increases. So when I do handwriting practice in my session, first part, first 15 minutes, I do mat exercises through all this. Okay, I can go in detail, but I'm just going to just try to stay focused on the time limit we have. Tapare dharantu the fire element, which helps with the hunger and thirst. Jodi apanakar fire element active nahi, se chua mankar constipation heichi, how would you expect the kid to function well here? Again, the gut and the brain, they are completely connected. So giving them the right kind of food, which brings down to eating a lot of fish, omega fatty acids, such as fish, carrots is good for eyes. A lot of our kids with the diagnosis of autism, they have milk, wheat. सेठरे तांकर बहुत एलर्जीज थाए. So we also have to make sure कि आम पिला माने राइस खांतु, probiotic खांतु, दही, पखाଳ भात, आमर ओडिसा रे पखाळ भात is the best food for the kids because that helps with the probiotics, with the gut health. आपण regular sago, परिवा. I know the kids with autism will come into the oral hypersensitivity, ଆଉ ତାଙ୍କର certain texture problem ଥାଏ. I understand that, but if you give them chips, if you give them ए जो carbonated drinks, तांकु pizza, तांकु विभिन्न प्रकार जिनस आजिकल जोटा कि सब आडे मु देखुछि यूनिवर्सली ऑल ओवर द वर्ल्ड वी आर गिविंग ऑल दीज फूड दैट इज नॉट गुड फॉर द गट. आउ जेहेतु तांकर गट टा एते सेंसिटिव, इट इज वेरी वेरी इंपॉर्टेंट फॉर अस as caregivers, as parents, as grandparents, as friends, तांकु home cooked simple meal which is gluten, जो थरे gluten न थाए, जो थरे extra salt न थाए, जो थरे बाहरु packaged food बिल्कुल भी खाया को मैंने, you can make it like once a month but not like every weekend जाए कि खाए बा बाहर खाए बा. That we should restrict, and that is what relates to your fire element in your stomach. आपनकर जो स्पेस एलिमेंट विच इज जोटा कि बाहरे बाहरे जो बहुत सारे लोक छुआ मान को नहीं कि आमे जो पार्क रे नहीं कि जाउतला आमे खेलुतला आमे जेबे हमरो जनरेशन वी यूज्ड टू, वी डिडंट हैव टीवी, वी डिडंट हैव phones, we were outside playing. That would give that element of space that they need in their body, so that helps to neutralize their sensitivity. बाहरे जो आपण खेलिबार जो देखि छन एठे राइट साइड रे विभिन्न प्रकार एक्टिविटी जोडा आमे जो सी सॉ खेलुथुलु, जंप रोप खेलुथुलु, स्टैपू कहथुलु जो पके की जो जंप करी करबा, आ जो दोली रे झुलिबा. आउ ए जो जिनसडा, this is very interesting because I want to thank Preeta for all the pictures because constantly I have been using all these ए जो आमे ओडिसा रा में खेलु सबु गेम्स गुडा को मु मोर थेरेपी सेशन रे यूज करछि. In my therapy session it is so powerful. मु बुझाई दउछि काहे कि जेतोळे आमे दोळीटा यूज करो वेस्टिबुलर स्टिमुलेशन, एटा कहंती वेस्टिबुलर स्टिमुलेशन, सेथरे आपनकर हियरिंग जेतोळे पिलाटा दोळी रे बसे कि टिके झुले सेथरे तांकर hearing out जो vestibular system आम brain रे अच्छी सेटा stimulate हुए, which also helps in learning. Okay, attention focus in the classroom, that it helps. So जेबे आमरो पुराना जमाना रे आमे दोली झुलुथुलो कि गच्छ ऊपर चढ़ी कि उल्टा ही कि झुलुथुलो, you know, that is the natural way that the body seeks those sensory input, and आमे integrate सेटा करूथुलो. सेतोळे हमको से काल रे तो आमरो therapy थिला भी नहीं, आउ we didn't eat out. So, you know, we didn't have as many, and maybe there was not early detection either, which is happening now. So then, dharantu apna e jo pittu khelare khelanti jo eye hand coordination hue. Then you also have to run. So your motor skills. Jodi ame words guda ko English words use kariba, ame e sabu jinso use kare, kintu apna bhabantu kemti amaro ancient zamana re or even in Odisha amar kitte sundar activity, simple activity. You don't have to spend money. Mane bahut sara parents mate kahanti oh ame therapy session jai panu ame chua ku nei panu kaina bahut expensive. Yes, it is expensive when you go to therapy sessions, but এই ସବୁ activity जोटा हमें completely deprive कर दी चुनी जी को let's go back to our roots again and start doing those things simple things हाथ धरी कि छुआ संगरे जदि बुलिबे आपण चारियाड बुलिबे you know that helps with the movement in the ear canal जोटा again vestibular balance a sense of seeking that sensory seeking जो छुआ मान करे थाई movement करे को that is fulfilled and ए सब activity करे कि धरी कि तांको टिके बसांतो गोटे 5 minute बसिबे you put a timer on and see if they can sit on the chair and table you will see results or at least if you sit in front of them and just second tilagila eye contact that will come social interaction kotha heba you will see difference so let's take our kids outside the house and do simple things like this taking turns ये जो जब आम लट्टू खेलुले लट्टू जो पकाउथुलो एमती पकईकी सेटा को देखिबो तमे आ धरिकी सेटा को you pick it up you know it requires a lot of eye hand coordination lot of precision something that a therapy session would do with so much problem solving but when you engage a kid in the play and there is another kid that they have to model they learn quickly very quickly so जो गोटी वाला that game I started it it's छुआ मन को बहुत पसंद they want something new आ सबो जिंस ताको ना play based आमे करू because when you do play based it doesn't feel like they're learning a trade they just get into it get in the swing of it आखी बंद करके जो पट्टी बांध के जतला आपनकर visual apparatus बंद हे जाय you use your kinesthetic sense धरंतु आपनकर लाइट पड़ेला आपण गोटे रूम रो आउट रूम को जाय की जो लैम्प की टॉर्च आने को गले जबे आखी बंद करके एमती चली के जाउछंती so you use the sensation in your joints that will make you move when your visual apparatus is not working so सेटा ए जो गेम फर्स्ट गेम रे जो पट्टी बांधी के आमे करथिलु रुमाल चोरी करथिलु so these are the things हमको I think we should go back to that next slide please case stories how much time do we have Sunilji I have lost track of time
नहीं अपन नियंतु समय अपन के समय लागियो आपण भाबुचंती
um
we don't
we
have
should
any time limit actually but then we should have a question and answer session at the
yeah
end of
that's why
the education.
yeah that's
Okay.
why I think
But
we started at it's been
we
1
started
hour
at 7:10 now the time is 8:15 so we are just
okay
1 hour into the
okay so
okay
okay
so you can
so
take half an hour more
yes 1 hour more for my presentation or just total
half an hour more you can make presentation and then we can switch over to question and answer session but then if it is 45 minutes also no problem.
Okay, thank you. Sorry for this interruption. I usually get into a different mode because I'm so passionate about this. Okay, so intervention case stories. This is something, you know, sometimes I hesitate to say this, but then I want to because I want to give a sense of what I'm talking. कारण जदि आमर मु जहा कहूची मो आइडिया जदि applicable हबनी पिलानक पाई if I don't have success stories I cannot really connect with my parents so this is for the parents basically first case history I'll just say this was 19 to 20 years old good kid mo pakho asila he had cerebral palsy had a lot of tone in the left side godo tight hato tight and he would keep his hand like this on his ear and he would not make eye contact with me empty side re asiki bostula mo sangare and they have se gote empty home re rothla where there was a 24-hour caregiver and they said he had difficulty taking baths bilkul bhi nijaro bath se nahi any haircut bahut difficult so then there is something called Z vibe or India re bodhe nuke brush kahante sethre vibration seta gote battery operated brush achi so what I did for my intervention I took all the history and he did have some traumatic issues when he was little he was in different homes taro tike home life ta was very bad unfortunately. But anyways, they brought him to the home, and the state got in, and they're doing a wonderful job taking care of him now with the support system they have. The reason he came to me is ସେମାନେ କହିଲେ ତା ହାତଟା ବହୁତ ଟାଇଟ୍ ହେଇଯାଇଛି ଆଉ ତମେ therapy occupational therapist ସେ shoulder ଆଉ elbow ଆଉ ହାତକୁ exercise କରିବାକୁ ସେ ମୋ ପାଖକୁ ଆସିଲା. That was the doctor's prescription I got. So when I did the evaluation, I was talking to the caregiver. ସିଏ ଗୋଟେ different story କହିଲେ. ସେ କହିଲେ ଏମିତି ତାର ବହୁତ ସାରା sensory issue ଅଛି. And the caregiver told me he was very receptive and said that this kid seems to have potential, but we don't know what to do. Can you please help? So I did my detailed assessment. I did my sensory evaluation. I did my reflex evaluation. It was so strange that he still had that rooting reflex. When I stroked his face, he would turn to the right. So that explained why he didn't eat. Se kichi bhi mane regular food खाउनथला, बहुत aversion थिला. पाटिरे किछि he would only eat peanut butter jelly sandwich. आउ किछि खाउनथला ताठु fruits vegetables किछि भी खाउनथला. आउ सबु बड़े aloof है कि निजो room रे, and only thing he liked was wind chimes, the noise of wind chimes. So that is something we thought that would be a reward. Jodi kichi gute bhalo behavior kore, reward debi. So once I detected a lot of reflexes, I started working with him to integrate those reflexes. And very strangely, he just took a complete U-turn. It's almost been 8 months. I will not go through the detail of what I did intervention-wise, because I also worked with the speech therapist. Amaro clinical speech therapy, our OT and PT, we work together. So if we have one kid, we do it an interdisciplinary approach, which is very essential for kids with autism spectrum disorder. Amko nihati darkar ki psychologist, PT, OT, speech, something ko include kariba. So when we started working, taro bilkul bhi word kichi bhi word nathila. So then she brought in an AAC device where it chotto gote laptop. It's like a tablet where you have different things that he points out to. And muta sangare seta tike kamo kali, speech therapist kamo kala. And I did a lot of sensory brushing, bahut sara brushing, say vibrate kariva machine re se hato ko ye kolu, tapre neck out muho chariade seta ame sensation deki, tapre weight bearing exercises सब करके. Right now he's 20, he's going to be 21 years old, 20 years old, and he enjoys the drive, long drive. He goes to Walmart, it a bada superstore ache, sete jaiki se tanga sangare interact korchi, shopping korchi, and he smiles and he calls me Miss B, Miss B. So to me that's a huge accomplishment. He's allowing them to give him a bath. Now that is something good reflex achi called spinal gland reflex. If it is retained, जदि आपण गोटे spine को दी आंगुठी ने के slowly set up करिवे, or there are different exercises you do, but that's what I did. So that helped him to desensitize waist down, जोठे बहुत सारा sensitivity थिला सिर्फ में गाधे को जाओ नथला. So now he's able to take his baths. He takes 2 baths. He's able to get his haircut. His communication skills has improved. Ebe one hand re he's playing basketball. Say throw koruchi. Ago bilkul bhi. Mane he was very much सिकुड़ के, जो कौन थी हिंदी रे बहुत ही घबराया हुआ सिकुड़ के रहता था. अभी now his posture has completely changed. Now he's like very open, arms down, walking with good posture. That is one of my very successful stories, because he was like 20 years heigala ke habani kichhi improvement habani. So for him the goal is to be able to socialize with his peers. ता संगरे और तीनटा चारटा same age रो पिलावन अछंती with similar problems. Seta तार goal to be able to eat. Now he's eating macaroni, cheese, से salad खाउची, तो different धीरे धीरे improvement होची. आउ recognize करची, मते देखिले बहुत खुशी हुए. आउ आमरो goal हला, आमरो big goal is to get him into Paralympics, hopefully next year, like for basketball, just doing the free throws. That is our goal for him. So if this changes anybody who has an older kid, I mean, most definitely it's a very promising thing. It just makes me very happy. I'm a physician, jo amara group re physician achindi, he came and she actually, they are two of them, they both came and they were very happy with the progress he made because everybody had given up. You know, it's like, oh, he's not going to get better. It's too many years. That is one. The second one I would share is, this is our miracle kid, we call. Parents were very active. 5-year-old kid came with a lot of sensory issues. ତାକୁ ଟଚ୍ କଲେ ତା ଦେହ ଯାକ ରେଡ୍ ପ୍ୟାଚେସ୍ ହେଇଯିବ, ତାକୁ ବିଲକୁଲ ଟଚ୍ କରିବାକୁ ଦଉନଥିଲା, ସବୁବେଳେ ମା ସାଙ୍ଗେ ଚିପକିକି ରହୁଥିଲା. He is 5 years old, could not speak, bed wetting issues, ମାନେ trainer pant ପିନ୍ଧିକି ଆସୁଥିଲା, could not hold a pencil. He was ତାର 4-year-old ଗୋଟେ ବର୍ଷ ଛୋଟ ଭଉଣୀ ଥିଲା ଯିଏକି କଥା ହେଇ ପାରୁଥିଲା, but he could not talk, so he was very frustrated. Lot of fear issues. So ଯେତେବେଳେ ଆମେ ମୁଁ ଆଉ ସ୍ପିଚ୍ ଥେରାପିଷ୍ଟ ଦି ଜଣ ଆମେ କାମ କରୁଥିଲୁ ସେ କିଡ୍ ସାଙ୍ଗରେ, in the matter of last 6 months, now he's talking, he's completely independent in toileting. Our goal for him is by this coming August, he will be going to school. So तार एबे भी बहुत सारा tactile problem अच्छे से खाई पारेनी, बहुत कम जिनस खाई पारची. So nutritional problems अच्छे, सेटा में we are trying to work on that through reflex integration, sensory integration, speech. Our speech रो बहुत important speech and occupational therapy to correlate and work together. So the speech and I, we do a lot of reflex integration and sensory integration techniques to get the kid to where they should be. Mane, amaro goal eta nai ki this kid will do what a 6-year-old kid does. For us, it's very, very individualized. We ask the parents, what is your goal? What is your practical goal? You cannot say, oh, moro chuata a 6-year-old bhaliya kama korchi. It is different. The brain of our kid, our neurodivergent kid's brain is totally different than a neurotypical kid who would do different things in a different way. So that's where we try to, bring in the expertise and try to work. So this kid is, again, a success story. Out at 18-month-old kid, he would not lay on his back. ତାକୁ ଡାଇପର ଚେଞ୍ଜ କରିପାରୁନଥିଲେ ମା ଆଉ ବାପା ମାନେ, ବହୁତ ଡିଫିକଲ୍ଟ, ବହୁତ କ୍ରାଏ କରୁଥିଲା, ବହୁତ କ୍ରାଙ୍କି. They had to give him medication, melatonin, to sleep. So again, with reflex integration, sensory integration, speech, play activity, we do a lot of play. Through play, we do treatment. ସେଟା କଲା ପରେ ସେ ଛୁଆଟା ଏବେ he's 2 years old. He's got 15 words. He comes to the clinic. Hatta dhariki, amo hatta dhariki, he comes down and he chooses his play activity. We play, we do exercises, and now he's able to lay in the bed on his back, which is a huge thing. It's a gravitational insecurity thing that happens for kids who have reflex issues. So se taku suai dele ekdam aram re soi mane godi ki tapare pette ki, so se sobu jinsa se koruche. So that's another one, and the list goes on. There are very lot of things. So next few slides mu apanku visually dekhaibi jaha mu koili, it will make sense to you from the pictures. Yeah. एसबू एक्टिविटी जहाँ देखुंटे, इट लुक्स इट्स वेरी वेरी इंपॉर्टेंट. जो फर्स्ट जोड़ा घर बनाई से देखिए ब्लैक बैकग्राउंड, इट हेल्प्स देम टू डू द विजुअल परसेप्चुअल थिंग, जोटा कि डेप्थ परसेप्शन. व्हेन दे गोटे ड्रॉर रु खोलिकी जिनस काढ़िले, फिगर ग्राउंड परसेप्शन, ए सब जिनस लगे आम एक्टिविटीटा कराऊ. द ट्रायंगल शेप्स, सेटा भी बहुत सारा आपनकर विजुअल परसेप्चुअल इश्यूज डील करे. जो आपण देखुछंती जो राइट रे जो शेप्स अच्छी, डिफरेंट कलर्स शेप्स, सेटा दैट टीचेस देम मैचिंग आउ कलर कॉन्सेप्ट एंड शेप कॉन्सेप्ट एंड स्पेशल, माने कोटा केमती धरिबो, इवन द फिंगर, द डेक्स्टरिटी वाइज. जो द लिटिल पॉम बॉल गुड़ाक जोटा राइट रे अच्छी, ब्लू एंड व्हाइट, से आपनकर टेक्सचर्स जार टैक्टाइल डिफेंसिवनेस अच्छी, से सॉफ्ट सेंसेशन टा फील करछंती, तांको बहुत बढ़िया लगे, केबे बढ़िया लगे, केबे एवर्जन भी हुए, से केबे टच करंतिनी. सो we encourage them through various like little dolls, have them look into that or pick up those things. So it also through play ame सब intervention कराओ. And then आपण जो मझिरे जो ए जो क्लोथ स्पिन देखुछन जोड़ा कपड़ा झुलेवा को आमे यूज करू सेगुड़ा को बहुत बढ़िया फॉर द टिप टू टिप प्रिहेंशन हैंड स्ट्रेंथ काने ए तीनटा फिंगर आमे धरू पेंसिल. So if they don't have that tip to tip prehension and strength, they will not be able to hold the pencil. Same thing with the next one for the hand exercises. Yeah, next please. Okay, again, देखुचंती आपण hand on hand बहुत सारा kids मान को हमको hand in hand because the depth perception टा तांकर न थाए building जतोळे spatial awareness develop हुए through that. जोटारे आपण देखुचंती छोट छोट बॉल अच्छे से मान को sensory awareness हुए hand functions balance विभिन्न प्रकार एक्टिविटी जहाँ भी आपण एठे देखुचंती सेडा सब हमरो डिफरेंट गोल्स थाए से अनुसार करू किंतु जो लास्ट वन आपण देखुचंती से if you go back please. Yeah, the last one. So जो ball pick करचंती again that is called a pincer grasp. The pincer grasp is a predisposition to the pencil grasp. जोड़ा pencil रे लिखुचंती सेटा लगी ए एक्टिविटी टा बहुत important. आ ता पूर्वरु जो देखुचंती press करचंती पिला माने एटा आपण जदी पचारिबे हमरो घरे आम इंडिया रे केमती करू आपण जो खाइबा बासन ना नै कि जो आपण को डाली जो चकड़ो ना डाली टा को मैश करचंती सेटा आपण यूज कर परिबे एठे. So all these activities which we are using here can be done at home. Just take a creative thinking. हेबाकु पड़ी बारे. Next, please. Okay, so जोड़ा reflex integration कहली जोड़ा आपण देखु चंदे थरे बहुत सारा activity जो ball रे दो जो ये करछि सेटा गुडे palmar reflex अछि जो जदी active होबो ना palmar reflex जदी integrate हेइ नथिबो retention थिबो सेतरे से छुआ मनकर खाइबार problem है. So we work a lot on desensitizing that with different textures. आउ जबे आपण देखिबे जो चालंती पिला मनकर गोड़े रे भी बहुत सारा माने जेतोळे पादरे सेंसिटिविटी थिबो से माने टो वॉकिंग करिवे. सो सेटा को कमेवा पई आमे तांकू डिफरेंट टेक्सचर्ड सर्फेसेस रे वॉक कराउ जंप कराउ. सो जंप कले तांकर वेस्टिबुलर सेंसेशन भलो हबो आई हैंड कोऑर्डिनेशन हबो. अगेन कलर शेप टेक्सचर्स सर्फेसेस ए सब जिंस जोड़ा हमको बहुत इजी जोड़ा हमें इवन भाबुनु सेमान को पई प्रत्येक एक्शन ता तांको भाबिया को पड़े. So that's why it slows them. Okay, next. Okay, this is something that सबु kids माने sand रे खेले को बहुत पसंद करंती and you put stuff in the sand, so this helps them to integrate their sensory hypersensitivity जार थिबो आपण foam रे तांको letter लिखे पारिबे foam रे. You can do the kinetic sand. It just through play आमे जो sensory जो कहथली मु seeking जो गुडा को थाए सेगुडा सबु हेल्प करे. आ परे जतळे आपण ए सब जिंस करि सारंती तांकर हातर मूवमेंट हातर स्ट्रेंथ सब आसे थ्रू एक्टिविटी तापरे जदी बसे कि आपण लेखिबा पई फोकस करिवे then it gets better. Yes, please. Again, the writing skill, as you have seen, pencil केमती धरंती बहुत भूल भाल धरंती एगुडा सब किछि किछि एड आम पाखरे थाए जो थरे कि तांको हेल्प करे to hold the pencil correctly if they are not able to. And there you can use a rubber band. गोटे rubber band को धरंतो आपण एमती धरले rubber band को धर कि सेटा को गोटे पेन टा को पेन किबा पेंसिल को नेले एटा को टर्न कर देले आउ देखंतो एमती. Just simple thing you can do, and that way the pencil doesn't drop, so they just hold the pencil like that with a rubber band. Say jinsa आपण कर परिबे. There are different things you can do inexpensively. माने पैसा दे कि खर्च करके किनिवा दरकार नहीं. Just using a few techniques you can do. Speech and reading, again, that's very very important. मु बहुत coordinate करे speech therapist संगरे तांकोठु माने सिखे. Usually they say you walk and talk at the same time. So 12 months is how within 7 to 12 months रे तो babbling हुए छोटे छोटे words कहती किंतु 12 months हे गला आपनकर छुआ माने कथा होनाती then it is really long माने we have to get on to the speech. So speech is very very important in the development of language and reading skills. Yes. Okay, this is a very very new concept, especially after COVID. आपने देखिछन्ती most kids have gotten into the tablets, phones, laptop. They hardly connect with. They don't do eye contact. Even the so-called neurotypical kids, they will not be able to converse. जदि आपने तांको across the table बसेबे कथा हेबे the emotional aspect is very hard. They get frustrated easily. So most of my kids, every session I start with, how are we feeling today? Are we happy? Are we sad, worried, angry? So they bring the awareness right away before doing a task. How am I feeling? So when you do that, the emotional regulation is what it's called. Because bahut sara kids, even like I said, neurotypical kids or neurodivergent kids, it doesn't matter. In this day and age, with all these gadgets, we are going away from the emotional connect. We are working on a very, we don't know how to talk about our emotions. We don't know how to express, today I don't feel right because I didn't sleep well. If you don't sleep well, you won't be able to stay upright in the classroom and attend to the task. So suppose we decide I am angry, okay, I feel angry. Then we mark, today I'm angry. So then how do we go from angry to being happy? That is our goal. So we have different techniques. First is identification. I didn't go in detail, but this is something I work with every kid in every session. They first have to identify internal, interoception, jota gote, how do you feel? Are you hungry? Are you thirsty? Are you sleepy? Are you upset? Are you happy? When they know that, then they come out. Okay, if they know that and they come to the green zone, how do we come to the green zone? You can do weight bearing exercises, you can do breathing, you can come to therapy and talk occupational therapy and say, this kid who was very hyper, he would always come to the therapy session first thing in the morning, do his exercises, and then say, Miss B, I'm feeling normal now. Can I go back to my classroom? He would go back to the classroom. Again, lunchtime, he would come. So the awareness that I am hyper is the first step of getting better or getting emotionally regulated. It is very much important in this day and age. आपण समझते even आपण regular kids ମାନଙ୍କ ସାଙ୍ଗରେ ବସିକି ଏ ବିଷୟରେ ଟିକେ କଥା ହୁଅନ୍ତୁ. Next, please. Activities of daily living, that's something we do as occupational therapists. Our sabu activities geared towards their functional task. Are they able to brush their teeth? Both sara kids, they will not brush their teeth because of oral sensitivity. Are they able to hold the spoon and fork? Some of them, they drop this fork and spoon and they'll make the messy eaters have a shoe and socks. When you go to school, they have to be able to put on the shoe. The hatare bilateral integration, making the rabbit ears shoelaces tie karanti, seita difficult way. Telling time, that is another thing that is very, very important. But one thing I will say, the kids who have the diagnosis of autism, they have a body clock. They are connected with the weather. If the weather gets bad, suppose good a storm tornado or we have cold fronts. Before the cold front comes, they will start acting differently. They will be irritable. And then we talk, okay, the cold front is coming, or there is full moon, or something is changing. I think the reason being, tankara jo auditory, tankara jo hearing, tankara jo vestibular is very, very sensitive. Ours is not, theirs is. ଆମେ ମଡ୍ୟୁଲେଟ୍ କରିପାରୁଛୁ, ସେମାନେ ମଡ୍ୟୁଲେଟ୍ କରିପାରୁନାହାନ୍ତି, ସେଇଥିପାଇଁ ସେମାନେ ଫିଲ୍ କରନ୍ତି ସେ ସବୁ ଜିନିଷ। ଆମର typical therapy gym ରେ ଦେଖିଥିବେ ଆପଣଙ୍କ swing ଅଛି, we have trampoline. Trampoline is something we use pretty much with all the kids. We have balancing board, a little soccer thing that we have there, a therapy ball. That's one of the thing that I use on pretty much all the kids to do the exercises. Yes, next please. Music and games. I truly believe mujo panchabhuta koruchi sathire a ma, which is om. When you put together, it becomes om. But the concept of the sound is very, very healing. Music, any kind of classical music on the background, it's very good. When I do things, we usually will put some form of music, and they'll say, oh, this is Indian music. So usually flute background, very gentle flute music. It helps to calm them down. Again, the whole purpose of this is to embrace neurodiversity. Jadi, as a lay person, we are walking on a street, we see a little kid throwing a fit, not listening to the parent, instead of judging the parent, instead of saying, oh, se pilada bahut unruly, we need to stop and think, is the kid having some special issues? Yes, we have behavioral issues, and for that we do behavioral modification. I know discipline could be a factor, and it could be a neurotypical kid, but it also could be a kid with autism spectrum disorder who is not able to manage the emotions, who doesn't know how to process the sensory things, and that's why we should stop and think. And at least now that we are able to understand the concept of neurodiversity. Let's embrace it. I don't know if it will be right to say this here, politically correct or not, but मुझे कोई कि जोड़ा कि मोर personal, this is completely my personal perspective. Sibonka Chariarde Gona Thante Gananayak is Ganesh. We always do Namaskar to Ganesh because he is Amaro Sabu, Vigna Harak. So if we do that to the gods, why are we picking on kids who are a little different than us? Why can't we have the same thing that God resides in every human being, every animal, and we just include them as part of us? And with knowledge, with education, we should be able to, in the educated world, we have so much resources, we have platforms to share all over the world. Help to each other. And it doesn't matter where you come from or what you have been put into. God resides in each and every one of us, and I'm supposed to say atmataku respect dabak padibo. And instead of judging, instead of separating a family who has a kid with special needs, let's embrace them. Let's bring them into our life and say, what can I do to help you? And just previously, I was talking to a gentleman in this group who I suggested to have support groups. That's very, very essential to have a parent have like 10 parents talk about their kids. So different solutions jota se mane use korchunde, they can come on a platform like WhatsApp and they can discuss, this is what I'm doing. Maybe this will help your kid. So, let's be supportive and let us not exclude anyone from living a life to the fullest extent. With all their strengths. Let's look into the strength. Let's look into the pain of that mother who does not sleep nights after night because the kid is awake. And let's not judge them or put them down or belittle them and just say that, okay, this is a community. Ame sabu misiki so agents sodaku help kariba, solve kariba, give them a break, let them go out and be the caregiver, or even as grandparents. Let's go back to staying together in a village with our grandparents. Joti ki se chuata ko bahut sara noises ro exposure ho. Ame bahut nuclear families he jai chu ebe ame we are working families. Ame work koruchu chua manka sangare se interaction jota ago kala thila jebe amaro grandparents mane kette input dothile. It's all gone. So I think we need to go back. We need to go back and rethink. This is a situation which we need to take control of right now. Government, state government ko request kariba ki integrated school karibe. That's one of my goals, is to bring what I learned here to back home. If I can talk to, if there is a platform, if you guys know, I would like to go there and share how we are doing things here and how we can incorporate the same things in Odisha. And Odisha is, I'm so proud to be part of Odisha. And Jodi say jinsoda mo kari parli kichi bhi platform hai, please let me know. Like I said, I'm always willing to help with whatever I know. And I'm still learning, as everybody said. Again, 2nd of April is going to be World Autism Awareness Day. So we will try to do something if possible. But I have my email. You can connect with me on WhatsApp too. So thank you so much for this opportunity. And Eta, I know this is Kalingahistory platform. And to me, I feel like that is, that is my contribution. Thank you so much for this wonderful opportunity.
Thank you,
I'm
madam.
ready.
Thank you. बहुत सुंदर थिला आपनकर टॉक, बहुत इनफॉर्मेटिव. मु भाबुची हमर जो पेरेंट्स मान अछंती से माने बहुत व्यस्त होबनी आपन संगे कथा दवा पे. ମୁଁ ଅନୁରୋଧ କରିବି ପ୍ରୀତା ମ୍ୟାଡାମ को ଆପଣ क्वेश्चन आंसर सेशन आरंभ करंतु एवं जो माने चाहुचंती भाग नवा पे आपण हैंड रेज कर पारंती किंबा आपन चैट बॉक्स रे भी आपण मेसेज टा ये कर पारंती प्रीता मैडम सुनचंती
Again, please, whoever has a question, because I saw in the chat there are some parents or participants who have joined from Gujarat also. So I'll just be speaking in English for everyone. If any one of you have any questions for Ms. Babita Patnaik, please raise your like arm, like the hand button, raise your arm button. Or if you are not able to do that, put it in the chat box. Okay. Sushmita Mahanti, I see, has raised. Can you please unmute? ଆପଣ unmute କରି ପଚାରି ପାରନ୍ତି. ସୁସ୍ମିତା ମହାନ୍ତି ମ୍ୟାଡାମ ଆପଣ unmute କରନ୍ତୁ ନିଜେ. ଆଜ୍ଞା ଯଦି ଆଜ୍ଞା କରିପାରୁନାହାନ୍ତି ତାହେଲେ ଆପଣ chat box ରେ ବି ଲେଖିପାରିବେ. ତା ଭିତରେ
हेलो मैडम
ଡକ୍ଟର ଆଜ୍ଞା ଆପଣ ଆପଣ ପ୍ଲିଜ ହ୍ୟାଣ୍ଡ ରେଜ୍ କରନ୍ତୁ ଯୋଉମାନଙ୍କର କ୍ୱେଶ୍ଚିନ୍ ଅଛି ମୁଁ ଗୋଟେ ପରେ ଗୋଟେ ପଚାରିବି. ସେକେଣ୍ଡରେ ମୁଁ ଡକ୍ଟର ବିଶ୍ୱଭାରତୀ ମ୍ୟାଡାମଙ୍କର ଦେଖୁଛି ହ୍ୟାଣ୍ଡ ରେଜ୍ ହେଇଛି. ମ୍ୟାଡାମ ଡକ୍ଟର ବିଶ୍ୱଭାରତୀ ପ୍ଲିଜ ଅନମ୍ୟୁଟ୍ କରି କ୍ୱେଶ୍ଚିନ୍ ପଚାରନ୍ତୁ. ସୁନିଲ ବାବୁ କିଛି ଅନମ୍ୟୁଟ୍ ପାର୍ଟିସିପେଣ୍ଟସ୍
नहीं
ମାନଙ୍କର
नहीं
କିଛି
सब एनेबल करा है अनम्यूट कर दे कैन अनम्यूट देमसेल्फ एंड आई हैव ऑलरेडी आस्क्ड सुष्मिता महांती मैडम एंड डॉक्टर विश्वभारती मैडम टू अनम्यूट देमसेल्फ सो आई होप यू आर एबल टू अनम्यूट योरसेल्फ विश्वभारती मैडम कैन यू प्लीज टाइप इन द चैट बॉक्स वेदर यू आर एबल टू अनम्यूट योरसेल्फ
हेलो
ଆଜ୍ଞା
आपण सुनी पारछन्ते एबे मते
हाँ हाँ
ଆଜ୍ଞା
सुनी पाउछ
आज्ञा नमस्कार बबिता मैडम और समस्त को कलिंग इतिहास समस्त को नमस्कार जनाऊँगी. मैडम मु एक्चुअली बहुत दिन धरिकी आदिवासी मान सहित काम करिछि आउ रिमोट एरिया ओडिसा बहुत रिमोट एरिया विलेज मानकरे मध्ये मु काम करिछि. तो सेही जगह मानकरे मु केबे भी ए प्रकार समस्या देखि नाही. तो मु पचारिବାକୁ चाहूँगी जे केवल आजिकल तो मुझे देखुची केवल सहर मानकरे आम पिला दिने सहर मानकरे भी रोग नथिला. एटा को रोग कुआ कि कौन कुआ मते जाना नहीं. तो ए समस्याटा काहेकि आदिवासी माने जो माने जंगल भितरे पूरा पूरी रहउछन्ती नेचुरल एनवायरनमेंट भितरे आउ ता पाखापाखि गाँ मानकरे जो लोक माने रहउछन्ती तांको मानक भितरे ए प्रकार समस्या काहेकि माने केवल सहर मानकरे होउछि आ से प्रकार जगह मानकरे होउना.
Very interesting question and a question टा actually जाई परछि मोर ट्रीटमेंट जदि आपण जदि मोर presentation रे सुनिथिबे the concept of using nature nature is very healing आदिवासी population आपण जो कहिले जोटा यूज करनांती जदि आपण देखिबे जो छुआ जन्म होछि तांकर natural birth is more through vagina सेमानकर birth हुए तांकर they do nursing breastfeeding टा regular करंती ସେମାନେ ଛୁଆ ମାନଙ୍କୁ ବାନ୍ଧିକି ପିଠିରେ ବାନ୍ଧନ୍ତି କି ସାମ୍ନାରେ ବାନ୍ଧିକି ନେଇକି ତାଙ୍କର କାମରେ ସେମାନେ କାମ କରନ୍ତି କିନ୍ତୁ ବାନ୍ଧିକି ରଖନ୍ତି. they live in a community, they live in a joint family. They eat, they don't eat food which is tainted with salts bahar jinsa. So when you are in the nature, most of these developmental milestones you achieve these very naturally. Ame nijuku, the modern society has completely deprived us of all these natural way of healing. And that could be one reason. Secondly, the early detection. Maybe, I don't know if these kids are going to school, maybe they have not been screened for tankara class ki padha padi re mane gote normal school setting re jaiki jabe identify हुए तांको problem, maybe it has not been, they have not gone to that extent. So ସେଇଟା ବି ଗୋଟେ ହେଇପାରେ କାହିଁକି ନା ଏବେ early, the reason we are seeing more and more of these is most definitely the way things are changing with food, with not exposing our kids to the environment, having nuclear families. एगुड़ा सब बहुत सारे factors अच्छी, but there is also a genetic reason. There is also birth history. There is also trauma during birth. There are so many other issues that relate to the condition. माने धरन्तु सेमानकर सब normal हला, but तांकर जदि छुआ मानकर जदि गुटे meningitis हला, गुटे infection हला, which can also happen to kid with who is living in the Adivasi community. So it could be the combination of both, but mostly जोड़ा आपण कहले गाँ गंडारे एइथिपाई हुएनी because they already get all the sensory input that is required for a brain to develop normally. Hence, I use the concept of panchabhuta. I emphasize a lot to the modern society where we are deprived of that. So I hope this answers your question.
Thank you, madam. Thank you.
सुष्मिता महांती मैडम अनम्यूट करि पारु नांती किंतु से गुटे क्वेश्चन चैट बॉक्स रे लिखिचंदी मु तांको बिहाफ रे पढी दउची. I'm going to read the question what she has typed out in the chat box. She says, my child 15 years was hyper. Now he's quiet and stable. He can write what we think by human or pen touch. Now by pen touch now. How could procedure to know his knowledge? That's what the chat says here.
Okay, so there are a few questions I would ask about this. Is he going to school? If she can answer me, then I can go further. Because
madam chat unmute टा माने unmute टा को enable करा हिची आपण आउथरे चेष्टा करंतु निजो को unmute करबा पई आपणको से गोटे बटन देखा जिबा आपणकर ना पाखरे सेटा आपण क्लिक कले unmute हेइ जिबा कथा कहीं कि ना होस्ट को तरफ रु जमदी सुनील बाबू कहले किछि restriction दिया है नि म्यूट
अनम्यूट करा है प्लस इंडिविजुअली तांको भी रिक्वेस्ट करा है अनम्यूट करिया पे माने शी शुड बी एबल टू अनम्यूट हरसेल्फ एक्चुअली
पढ़ी दोची yes a special
yeah.
open learning system Bhubaneswar.
Okay, again it also goes back to if he is going to a special school. More next question thibo ki takara diagnosis निश्चय किछि दिया जाय थिबो for which the kid is going to the special school. When they go to the special school, and I actually worked in open learning system many years ago in Bhubaneswar. तांकर निश्चय गोटे occupational therapist थिबे, physical therapist थिबे, GA की and the speech therapist who will assess the kid as to what level they are in terms of language, motor abilities, sensory issues. तो सेमाने definitely से assessment करथिबे आपन संगरे आपन ताको पचारिबे कि share करबा को because I know they had back then, this is 30 years ago, they had classes, different classes, and I'm sure they have आपन को कहिबे कि आपन तांकर special ed teacher संगरे कथा होंतु to get this information. And the second thing would be to the OTs, because truly speaking, the parents, in my personal opinion, the parents are the teachers, or they are the main people who will know how the kid is functioning. So even though the special educators might tell you he's doing this, but you will know he knows swimming, skating, very good. Those are the things you do. And ma'am, if you don't want to talk, you can always call me, or you can email me, and we can talk in detail about this. Because he might have speech issues, he might have so many other, there are so many things that can happen to this kid, because if he's doing swimming and skating, that means he's got good balance. So I'm assuming he's able to sit still in the class and listen to the class. So hyper, yes. Yeah, hyperactivity, there, that's when we do reflex testing. Reflex testing रे बहुत सारा reflex integration techniques अच्छी जो थे कि पिलामने बहुत काम है जानती. आपने ताको I would always suggest a class in meditation, or just do Om, Tara Ucharan Karantu, ki breathing, simple breathing upare focus karantu, weight bearing exercise karantu. But those things, you know, I don't want to say without seeing. Yes, I would definitely help you if you connect with me on a personal level. Yes, definitely.
Thank you, Babita madam. ଏବେ ସୁଦର୍ଶନ ବେହେରା hand raise କରିଛନ୍ତି ଆପଣ ପ୍ଲିଜ ନିଜକୁ ଅନମ୍ୟୁଟ କରିକି କ୍ୱେଶ୍ଚନ ପଚାରନ୍ତୁ। ଶ୍ରୀ ସୁଦର୍ଶନ ବେହେରା ଆପଣ ଅନମ୍ୟୁଟ କରନ୍ତୁ ଆଉ କ୍ୱେଶ୍ଚନ ପଚାରନ୍ତୁ।
ମ୍ୟାଡାମ ମୋର କ୍ୱେଶ୍ଚନ ଥିଲା କି ମୋର ପିଲା ମାନେ ସେ ନିଜେ ଯୋଉଟା ଧରିକି ଖାଉଛି ସେଇଟା ସେ ଦାନ୍ତରେ ଚୁବେଇ ଖାଉଛି, କିନ୍ତୁ ଆମେ ଯୋଉ ଖାଦ୍ୟ ତାକୁ ଦଉଛୁ ସେ ଟୋଟାଲି ଚୁବଉ ନାହିଁ। ଖୋଉଛୁ ଯେତେବେଳେ ସେ ଟୋଟାଲି ଚୁବଉ ନାହିଁ, ମାନେ ପାଟିରେ ପୁରା ଘିଟି ଦଉଛି, ଢୁକି ଦଉଛି ପୁରା। ଆମକୁ ନିହାତି ଚକୁଟିକି ଦବାକୁ ପଡୁଛି।
Okay, my question is ପିଲା କଣ ମାନେ ଯୋଉଟା କହୁଛନ୍ତି ପିଲା ଚୁଜ କରୁଛି ଖାଇବା, ସେ କଣ ଚୁଜ କରୁଛି?
ମନେକର ଫ୍ରୁଟ୍ସ ଯୋଉ ଆପଲ ବା ଆମର ଯୋଉ ଆମର ପେଡା ମିନ୍ସ ଗୁଆଭା ଗୁଆଭା
ଆଚ୍ଛା, ହଁ, guava.
ସେଗୁଡା ଖାଉଛି। ଆଉ ଫ୍ରୁଟ୍ସ ପ୍ରାୟ ଫ୍ରୁଟ୍ସ ସେ ଖାଉଛି, କିନ୍ତୁ ସେଗୁଡାକୁ ଚୋବେଇ ଖାଉଛି। କିନ୍ତୁ ଭାତ ଦେଲେ ବା ରୁଟି ଦେଲେ ସେ ଟୋଟାଲି ନିଜେ ତ ଖାଉନାହିଁ, ଆଉ ଆମେ ତାକୁ ଦଳିକି ଦେଲେ ଯାଇକି ସେ ଢିକି ଦଉଛି। ସେ ବି ସେଥିରେ ପାଟିରେ ବି ଚୁବଉ ନାହିଁ, ପୁରା ଟୋଟାଲି ଢିକି ଦଉଛି।
Okay. So ଏଥିରେ ଦିଟା ଜିନିଷ ଆସୁଛି, ଆମର ଫୁଡ ପ୍ରେଫରେନ୍ସ। ହ୍ୟାଲୋ।
ହଁ ମ୍ୟାଡାମ।
ଓକେ, ଏଥିରେ ନା ଦିଟା ଜିନିଷ ଆସେ। ଗୋଟେ ଫୁଡ ପ୍ରେଫରେନ୍ସ, ଆମେ ସମସ୍ତଙ୍କର କିଛି କିଛି ଫୁଡ ପ୍ରେଫରେନ୍ସ ଅଛି ଲାଇଫରେ। So ଆମେ as parent, we totally ignore what the kids like. So the second thing, he's able to bite on the apple or khaiki chubeki mane ye korche. So for me, he doesn't have that much hypersensitivity. He can use his teeth and tongue to swallow korchi. So I would think it is a preferential thing. And sometimes chua man ko na se jo chakti ki khaiba guda ko pasand aseni. And how old is he now?
3 ବର୍ଷ 4 ମାସ, 3 year 4 months.
Okay. So again, this is a very specific condition. एठे ना आपन को देखिया पड़िबो से कोन खाइबा को कोन भलो पाउची, धीरे धीरे इंट्रोड्यूस करिवे। It make it his choice, not yours. जबरदस्ती बसे की ठुसी माने ये कले, he doesn't like it, so he will just swallow it. And it is also not good कारण आपन को digestion to mouth रे start होची ना, you need to chew it. तारो ताकू पुणी आपण गुटे स्पीच थेरेपिस्ट को देखौचंदी। Excuse me.
ଆଜ୍ଞା ଆଜ୍ଞା।
आपण गोटे ऑक्युपेशनल थेरेपिस्ट को भी जदि से माने रिफ्लेक्स इंटीग्रेशन करछंती।
ଆମେ ଯୋଉ ଦଉଛୁ ସେଠି ଯୋଉ ଆମେ ଦଉଛୁ ସ୍ପିଚ୍ ଥେରାପି 2 ଦିନ ନଉଛି, ଅକୁପେସନାଲ ଥେରାପି 1 ଦିନ ନଉଛି।
ओके, सो ऑक्युपेशनल थेरेपिस्ट आपण को निश्चय हेल्प कर परिबो, किंतु जदि इफ यू वांट a session with me, I would tell you what to do and what to test. Gradually introduction କରିବା କଥା। ଆଉ unfortunately ଆମେ इंडियन माने ଆମେ ତାଙ୍କୁ ଚକଡିକି ଖୁଆଇବା ସେଟା ଆମେ ଛୋଟରୁ ଜାଣିଛୁ, କିନ୍ତୁ 3 years ପରେ ତାଙ୍କୁ ଜବରଦସ୍ତି କରିବା ବି, ଯଦି ସେ ନିଜେ ଖାଉଛି, ସେ ଯାହା ଖାଉଛି ତାର ଗୋଟେ ଲିଷ୍ଟ ବନାନ୍ତୁ, ସେଥିରେ ଧୀରେ ଧୀରେ ଇଣ୍ଟ୍ରୋଡ୍ୟୁସ କରନ୍ତୁ। ମାନେ ଧରନ୍ତୁ ରୁଟି କି ପରଟା କରିକି ସେଥିରେ ଟିକେ କ'ଣ ତାକୁ ଯୋଉଟା ପସନ୍ଦ ଜାମ୍ ଲଗେଇକି ରୋଲ କରିକି ହାତରେ ଦେବେ, ମେ ବି ସେ ଧରିକି ଚୋବେଇକି ଖାଇପାରେ। Because if he is biting and eating, maybe that's what he wants. He doesn't
ପ୍ରିଫରେନ୍ସ ଚକୋଲେଟ ବେଶୀ କରୁଛି, ଚକୋଲେଟ ବା ମିଠା ଜାତୀୟ ଜିନିଷ ଗୁଡା ବେଶୀ କରୁଛି, କିନ୍ତୁ ଆମକୁ ଯୋଉ ଥେରାପିଷ୍ଟ କହିଛନ୍ତି ତାଙ୍କୁ ବେଶୀ ମିଠା ଦବାକୁ ନାହିଁ।
So it requires a lot of behavioral modification, discipline. आपण माने कोन खाउचंती, घरे कोन रखुचंती, it's a huge process. It's a huge
ବିସ୍କୁଟ
process.
ଖାଇ ଦଉଛି, ବିସ୍କୁଟ ଖାଇ ଦଉଛି, ସେମିତି ଚୁବେଇକି ଖାଇ ଦଉଛି। ଯୋଉଟା ମିଠା ଲାଗୁଛି ସେଇଟା ସେ ପ୍ରିଫର କରିକି ସେଇଟା ସେ ଖାଇ ଦଉଛି, କିନ୍ତୁ ଯୋଉଟା ତାକୁ ଭଲ ଲାଗୁନି ସେଇଟା ସେ ଖାଉନାହିଁ ଜମା।
तो ताको तारो प्रेफरेंस हला क्रंची जिंस, जोड़ा क्रंच करची सेटा ताको पसंद, so which I feel, because ताको जदी एप्पल पसंद, ताको जदी बिस्कुट पसंद, से चोबे की जो दांत रे ना ए जो TMJ एटा कहते TMJ, ए जो जॉर जो जगटा सेठे ताको ताको सीकिंग, ताको गोटे सीक होची कि he wants that movement. So आपण जदी मु आपण को किछि I will send you some exercises for jaw movement, oral motor exercises. से दीटा जिनस जदि करिवे तार बहुत सारा सेथरे कमी जिवे आई थिंक से कोन बहुत जंप करे डज ही लाइक टू जंप
नहीं जंप करेनी किंतु दौड़ा दौड़ी प्रबल करे माने हाइपर टिके अधिका हुए
So hyperactivity is because he's seeking that proprioception. Usually kids who will eat crunchy stuff, तांकर swallowing problem न थाए, तांकर seeking problem थाए. So जब आपण चिटिया जिनस दियंती, सेटा तारो tactile sensitivity लगी भी problem है पारे, आउ गुडे problem है पारे कि ताकू सेटा माने ताकू जोड़ा दरकार से सेटा पाउनी. तो आपण छुई भजा दे पारिबे, छुई भजा दे के देखंतो से जो चोबे की खाइबो. And
आलू मैडम आलू जो कटा है कि पीस पीस करा हुए भजारे पड़े से भजारू आलू गुडा को बाछी से खाइ दउची किंतु अन्य अन्य
Okay.
परिबा खाउनी
नो ताले आपण ए जो कुंदरी केते प्रकार मिलुची पटोळ एगुडा सब पूरा लंबा लंबा काटिकी टिके टेस्टी बने कि ताकू से खाए
अच्छा थैंक यू मैडम
ଏବେ
and you can
thank
connect
you
with
madam
yes
ମୁଁ ବି chat ରେ ଦିଟା ଲେଖିଦେଲି ମୁଢି ମୁଆଁ କି ବାଦାମ ଲଡୁ କି ନଟ୍ସ ଲଡୁରେ କଣ ଜାଗରି ଗୁଡଟା ଭଲ ଟେକ୍ସଚର ବି ମିଳିବ ମାନେ ସେ ନା ଆମର ପୁରୁଣା ଜିନିଷକୁ ଆମେ ଫେରି ଯିବା ଆମର ନିଜ ଖାଇବାରେ
मैडम से मुढ़ी मुआ तो नुहे से हमर से
ଉଖୁଡା ମୁଆଁ।
उखुडा मुआ से प्रिफर करूची उखुडा मुआ टा बहुत खाउची से
ତ
जो
ଏଠି
धान रे डायरेक्ट हां उखुडा सेटा उखुडा टा से खाउची भलो
थैंक यू बबीता मैडम
sweet
ଏବେ next
sweet sweet टा भी ना अत्यधिक देबेनी बहुत कम देबे but I think also
हां
as a जदि आपण as a parent balance
हमें भी मैडम चीनी टा को बंद करके ताकू गुड़ प्रिफर करूछु एबे आज्ञा
ଆଜ୍ଞା
so
ଏବେ
yeah
can we go to the next question बबीता
yes
मैडम
yes
So
yes
संगीता मैडम करो hand raise थिला तापर next interns मैडम संगीता आपण can you unmute and
Yes, ma'am. Yes. Nice to get connected with you all. मोर गोटे issue थिला, I wanted to address it. मोर गोटे पुओटे now he's 15 right now. So तार delayed speech थिला and माने he went to regular school. But delayed speech थिला then he had difficulty means टिके पढ़ारे difficulty थिला ता peer to say slow रहिला. Now he is in such a school it has SEN, so that under a speech therapy occupational therapy sabu aschi. So I made him join SEN at grade 3. So when he went mane taro nijo age ro pilango to 1 year delay re se taro padhiba arambha kala class 1 se 7 years re gala.
okay
So he was falling back in class support doutile, so I intervened and I put him under SEN. एठी कोन प्रॉब्लम होची आई फील राइट नाउ तार स्पीच एबे भी स्लरी टिके अछि बट नाउ विथ एज ओनली ही इज मींस डेवलपिंग व्हाट आई फील जहा भी स्कूल रु जहा भी हेल्प मिलुची इट्स नॉट ऑफ दैट आपण जेमती कहिले माने विद इन अ मैटर ऑफ 2 इयर्स ए पिलाटी सेरिब्रल पैल्सी रो पिलाटा भी चेंज हे परला बट सेही टाइप रो मु तार डेवलपमेंट देखु नाही तार एबे भी इश्यूज अछि टू टाई द लेस मैथमेटिक्स माने बहुत लॉजिकल से जिनसटा से टोटली पारुनी otherwise he takes commands very माने आउ किछि तार ये नाही जस्ट स्पीच रे जहा he cannot speak माने गोटे पैराग्राफ दे देबे टू or to you give him an essay write 10 lines on it he will not be able to do that अन्य सबु जिनस टेकिंग कमांड्स बीइंग डिसिप्लिन्ड एवरीथिंग सेगुडा से सबु करि पर साइक्लिंग प्लेइंग विथ हिज फ्रेंड्स सेगुडा सबु किछि ऑल द अदर थिंग्स बट ही इज नॉट इवन आमे एज किड्स माने इन ए ग्रुप वी यूज्ड टू बी माने थिएटरिकल ये कि कोठी गोटे जाकी स्पीच दियो गोटे स्टेज रे से जिनसटा जो फियर टा स्टेज फ्राइट जोटा कहंती सेटा तार अछि बट माने आपण आश्चर्य अब ही लाइक्स टू पार्टिसिपेट माने डांसिंग होल कॉलेज स्कूल रो एनुअल फंक्शन रे से प्रोग्राम रे माने ही इज डांसिंग शमक दव ग्रुप रे माने जॉइन करी कि सेटा करूची बट मु ताकू जदी एकुटिया कहिबी मो आगरे नाचे कि मो रो केते जण अछन ता आगरे डांस करे कि से समथिंग सेटा को से शर्क करिवो शाय करिवो तो मु एक्चुअली आई नीड ए प्रॉपर स्क्रीनिंग मते गोटे माने प्रॉपर मु ताकू स्पीच थेरेपी देइथिली at the age of 5 I started with speech therapy school रे भी चलिला माने class 1 रो ही चलला but सेही टाइप रो डेवलपमेंट मु आज पर्यंत ता पाइलिनी मैथमेटिक्स आई एम सॉरी टू से addition subtraction but मु एना ताकू पचारिबी 30 टा बड़ कि 50 टा बड़ he will stumble सेठी ही से फंबल करिवा आरंभ करिवो so at such a age my fear is how will he face the world सेटा होची मेन माने लाइफ स्किल टा से केमती एड्रेस करिवे मु सेटा जानि परनु एक्चुअली he needs proper screening मु एपर्यंत डेसिफर करि परनी जे एक्चुअली कोन तार प्रॉब्लम रहूची एंड कोठी रहूची there is some issue but कोठी रहूची मु सेटा माने एड्रेस करि परनु
Okay, so this is very specific condition, and I would like to discuss with you privately because I would probably have to go back to the birth history. If you are
Yes, I
comfortable.
did have a problem. I had issue of high blood pressure during my pregnancy. Last trimester, I had difficulty. So it's better to speak means one-to-one on a personal level. That is what I want. I want
Yes.
you to screen my child. I want to know everything. So means in the best possible way. Why did I go in for SEN? Only I needed the best so that she develop how. सेटा मते आपण माने से अनुसार गाइड कले सो मु को अनुसार ताको हेल्प करि परिबे दैट इज व्हाट आई वांट
Yes, I will be more than glad to help you. आपण मो संगे connect करिवे and we can talk about this in detail. And there is a solution, and that is reflex integration, which I have been doing. I've seen
आई एम
huge.
सॉरी टू से आमो स्टेट रे तो से अनुसार कोनोसी टाइप रो माने एई जिंसडा जो सेटा माने से टाइप रो फैसिलिटी तो आमे पाइलुनी मु तो बहुत चेष्टा भी करिथिली ता पीडियाट्रिक्स तो रूल आउट करले ऑटिज्म सो मु आउ माने बुझी पारलिनी व्हाट एल्स टू डू अदर देन स्पीच थेरेपी तापरे देखिली तार फाइन मोटर स्किल रे से लैक करूची से अनुसार से पे ताकू टिके ये करिवे आई विल टॉक टू यू मींस हाउ डू
Yes.
आई गेट कनेक्टेड विथ यू
I have my email that you can connect with, and then we can exchange our phone numbers, and we can go from there. We'll plan out. Jota, for other family, other parents who are in this, um, anytime we do a reflex integration, Jota mo kahili ki the first question I asked ma'am was I think Mrs. Mahanti, right?
संगीता
Sangeeta. Okay, Sangeeta ji, jo kahile, there is always a reason why I ask the birth history, because it gives me an immediate cue as to what I need to do for intervention. So with my experience, what I feel like, he is stuck in one of the reflexes, that if we integrate that, it will help with the neuroplasticity, because basically he does not have much sensory seeking from what I have heard. So the reason I'm communicating with the rest of the parents is the fact that there is a light. Don't just get fed up, because and that's the whole source of this talk, is to reach places where they can use my expertise to move a step further. So maybe we can find the reflex that he's stuck in, and then if we work on that reflex, you will see improvement in math skills, because for maths, that's a different part of your brain, and the connection has not been made properly. So and I can say that, but
and another thing is the second language. Here we have a second language and a third language. So ओडिया रे हमरो बहुत सारा जुक्ताक्षर अछि हां ठीक अछि त अल्फाबेट सिखि गला I pushed him till 8th because I wanted him to learn the mother language mother tongue tas, but still he had difficulty in means reading the odia, but he's able to read English very well बहुत बढ़िया भाबरे पढ़ी परिबो to speak also it's fine with English, but odia ho hindi ho he is struggling, so mu odia taku omit karibi. That is the main.
So here is what, again, you're doing the right thing, but here is what I would suggest. Again, why we are trying to compare with a neurotypical thing. So your kid is very, very smart. So we need to focus on his strengths right now. And I'm going to be very blunt with everybody who's here. Let's not compare our kids with anybody. We need to see what is our kid's strength and work on it. Jodi ame tanku tinta, and you know what, really, amo India ame bahut pressure do. Sorry, but we put our kids through so much stuff, which in real life, you need life skills to survive and do better
Yes,
in life.
that is
So
what
we
I
need
want.
to focus on that. We need to focus on adaptive skills. We need to focus on being able to communicate better, being able to express our emotions. Those are important in this day and age. Knowing multiple languages is good in our day and time, but ebe tar practical use kona kariba, and if it is impeding his learning of English, if we can focus on English and work on problem solving skills for maths and logical and analytical thinking, that will happen with the reflex integration. I'll assure you of that. So ଯେତେବେଳେ ସେମିତି କରିବା ନା ତାପରେ ଧୀରେ ଧୀରେ ସବୁ ଜିନିଷ will fall in place. So that's what I'm going to tell to all our parents and caregivers. Please be kind to your kids. I was very rough on my first kid because he was my first one, did not have too much experience. With my second one, I just backed off and she's blooming like anything. So ame support kariba, ame guide kariba, but let's not, they have little brains, they need to enjoy life.
Thank you, ma'am. I'll have a one-to-one talk.
Please connect with me and I'll
Thank you so much.
Thank you, Babita ma'am. Maybe next, Kullu Danta, I don't know how to pronounce, but the first name says Kullu. I had seen a hand raise and in the chat too. Kullu Danta Babu, if you can unmute and ask your question, please do. Or if you're not able to unmute, if you can write your question in the chat, we will ask it for you. Sunil Babu, ଆପଣ ବୋଧେ କ'ଣ କହୁଥିଲେ? Please go ahead. I think he's not able to.
ନା ମୁଁ କହିବା ପାଇଁ ଚାହୁଁଥିଲି ଯୋଉମାନେ ମ୍ୟାଡାମଙ୍କ ସାଙ୍ଗରେ କଣ୍ଟାକ୍ଟ କରିବା ପାଇଁ ଚାହୁଁଛନ୍ତି ସେମାନେ ନିଜର ମୋବାଇଲ ନମ୍ବର ଯଦି ଚାଟ୍ ବକ୍ସରେ ଦେଇଦେବେ ଆମେ ତାହେଲେ ମ୍ୟାଡାମଙ୍କର ଇମେଲ ଆଡ୍ରେସଟା ସେମାନଙ୍କ ପାଖକୁ ପଠେଇ ଦେଇପାରିବା। କୁଲ୍ଲୁ ବାବୁ ଆପଣ ଅନମ୍ୟୁଟ୍ କରିକି କୁହନ୍ତୁ, ମୁଁ ଆପଣଙ୍କୁ ଅନମ୍ୟୁଟ୍ ଆସ୍କ ଟୁ ଅନମ୍ୟୁଟ୍ ବଟନ ପ୍ରେସ୍ କରିଛି, ଆପଣ ଅନମ୍ୟୁଟ୍ କରିପାରିବେ ଆଉ ପ୍ରଶ୍ନ ପଚାରନ୍ତୁ।
Thank you, sir. Madam नमस्कार। ମୁଁ ଗୋଟେ କ୍ୱେଶ୍ଚନ ପଚାରୁଥିଲି ମ୍ୟାଡ଼ାମ, ମୁଁ ସୋନପୁର ଏୟାରରେ ସ୍ପେଶାଲ ଏଜୁକେଟର ହିସାବରେ କାମ କରୁଛି। ଆଉ ମ୍ୟାଡ଼ାମ ଅଟିଜିମ୍ ଆମର 4ଟା ସେକ୍ଟର ପିଲା ଅଛନ୍ତି, ଯେଟା ଆଇଡି, ଅଟିଜିମ୍ ଆଉ ମଲ୍ଟିପଲ୍ ଡିଜାବିଲିଟି ଆଉ ସେଭରାଲ ପଲିସି। ତ ମ୍ୟାଡ଼ାମ ଯୋଉ ଆମେ ଅଟିଜିମ୍ ପିଲାକୁ ଯୋଉ ହ୍ୟାଣ୍ଡେଲ କରୁଛୁ, ଯେତେବେଳେ ପୁରା ହାଇ ହେମ୍ପର ସେ ହୋଇଯାଉଛନ୍ତି ସେତେବେଳେ ଆମେ ତାଙ୍କୁ ଯେତେ ଚେଷ୍ଟା କଲେ ବି ତାଙ୍କୁ ଟିକେ ଆମର ଟୋଟାଲି କିଛି ମାନେ କ୍ୟାପଚର କରୁନାହାନ୍ତି। ତ ସେ ସିଚୁଏସନରେ କେମିତି ତାଙ୍କୁ ଟିକେ ହ୍ୟାଣ୍ଡେଲ କରିବା ସେଟା ଟିକେ ପଚାରୁଥିଲି।
ମାନେ ବହୁତ ହାଇପର ହେଇଯାଉଛନ୍ତି, ବହୁତ
ହଁ
ହାଇପର
ପୁରା ଯେତେବେଳେ ପୁରା ହାଇପର ହେଇକି ତାଙ୍କ ମୁହଁ ପୁରା ଲାଲ ହେଇକି ପୁରା ଇଏ, ସେତେବେଳେ ଆଉ କିଛି ଟୋଟାଲି ଶୁଣନ୍ତିନି, କାମୁଡି କରିବା, ଇଏ କରିବା, ଘୋଡେଇବା, ଦୌଡିବା।
ଆପଣଙ୍କର ଫର୍ଷ୍ଟ କ୍ୱେଶ୍ଚନ, ଆପଣଙ୍କର ଅକ୍ୟୁପେଶନାଲ ଥେରାପିଷ୍ଟ ଅଛନ୍ତି ସେଠି?
ହଁ ମ୍ୟାଡାମ ଅଛନ୍ତି, ବାକି ଆମେ ବି ରହୁଛୁ ତାଙ୍କ ସହିତ।
après second ଜିନିଷ ହେଲା ଆପଣ କୌଣସି ଜିନିଷ ଯୋଉ ମାନଙ୍କର ପ୍ରୋବ୍ଲେମ ଅଛି with diagnosis of autism or autism spectrum ADHD କହନ୍ତି, ମତେ ଲାଗୁଛି ଆପଣଙ୍କର ଯୋଉ ଛୁଆ ଯାହା ବିଷୟରେ କହୁଛନ୍ତି ସେମାନେ ADHD ଥିବେ କି ବେଶୀ ସିଭିୟର ଥିବେ। ତାଙ୍କୁ ଯଦି ଗୋଟେ ସପୋଜ ଆପଣ ବଲ ରେ ପକେଇକି ଆଗକୁ ନଉଛନ୍ତି, ଓକେ, କି ଆପଣ ଆଇର ମୁଭମେଣ୍ଟ କରୁଛନ୍ତି କି ତାକୁ ଜମ୍ପ କରିବା କହୁଛନ୍ତି, ଦେଖୁଛନ୍ତି ପିଲାଟା ହାଇପର ହେଇଯାଉଛି ଆଉ ବିରକ୍ତ ହଉଛି, you have to stop there. Okay? Then the next thing is how to stop that behavior. You can put him on the माने पेटेकी सोईकी गुड से सेम बॉल टा नेकी तारा पूरा पिठी रे रोल करिवे, सेटा रोलिंग करते, हेवी कंप्रेशन देबे, ताको गुटे टावल नहीं, गुटे कंथा नहीं की ताको गुड़े देबे, कहने ता बॉडी रे ना से सेटा गुटे एटा कामिंग जो मूवमेंट गुड़ा मु कोचे सेटा कहते प्रोप्रायोसेप्टिव मूवमेंट्स, से मूवमेंट्स रे सेटा को या बॉडी टा काम हवा। आपण जदी ताको मूवमेंट देबे सेतोळे जेतोळे से हाइपर होची सेथिरे से some kids will do good but there are some kids who will do an opposite effect. जेतोळे आपण को देखुचंदी बॉडी रो नाली हे जाउची, you have to stop that activity right then and there. ठीक अछि, गोटे जिंस कर परिबे तांको नै कि पानी रे टिके मुंह धुआई देबे, and they might be sensitive कान पछरे टच करकी एल्बो भितरे एडा सब योगिक टेक्निक, पाद धोई देबे, पानी ठंडा पानी पीवा को देबे, जदि से पिलाडे पानी पी, that will immediately bring that body's regulation to little bit of normalcy. किंतु सेही जिंस फोर्स करके आ जो जिंसडा ना से माने पार्टिसिपेट करिवेनी, आमे गुटे पद्धति रे गुटे रेगुलर ए जिंसडा करिवा ए जिंसडा करिवा ए जिंस, नो, every kid is different. Our discipline is okay, but doing the same thing again and again is also bad. तो प्ले रे करंतु कोनोसी जिंस जो एक्टिविटी आपण करूछंती सेटा प्ले एक्टिविटी माने खेलिबा, सेम जिंस कोन आपण बाहर कर परिबे, जदि बाहर कर परिबे चूज बाहर करिवा, एबे जणे स्पीकर कहले कि आदिवासी पिलानकर काहेकि होनी काहेकि से माने बाहर रहउछन सब टाइम सब बेले लाइट भितरे घर भितरे एयर कंडीशनिंग एथिरे रहुनांती तो तांको से जो नेचर रो हीलिंग इफेक्ट आसी जाउची तो आपणकर जो ए छुआटा को जदी हाइपर होची आपण जदी एनक्लोज्ड एरिया रे अछि सेमान को छाडी दियंतु दौड़ंतु से माने लेट देम रन देन कम बैक and then have them do the activity so आपण को ना टिके you have to think out of the box पिलान के संगे काम करिया को हेले आपण को बहुत तांको भलिया हेबा को पड़ियो किंतु जबरदस्त no it's you're not going to get any
Okay.
improvement ताको गुटे खराब लागिबो ना कोड जिंस संगे संगे you have to stop you can come back to that
Okay.
activity after 4-5 days but just change the activity in a certain way which can be which they will participate. And if you need personal questions, apna email karantu. I'll give you some exercises that you can practice or very specific question hele matlab very specific answer deba ko padibo setpai.
Thank you.
Again.
Thank you.
I don't see any more hand raises. Sunil babu apna tike jodi kichi kahibar achi dekhantu nahale if last call if anyone else has any questions please ask or raise your hand or write on your chat because anyway it has been quite a long session. Babita ma'am has been speaking continuously. She must be
I
also.
can keep on going, but I'm just following the.
Sunil,
time.
can you please take over and yeah.
Sure. Not only question, if anybody has any point to make or comments to make, they are welcome to make their comment now. So if
hello madam ଟିକେ यार ବେଶୀ ଟିକେ ଜିଦ୍ଦି କରୁଛି ଜିଦ୍ଦି କରିବା ପାଇଁ କିଛି ଏବେ just ଜିଦ୍ଦି କରୁଛି କାନ୍ଦୁଛି ବର୍ତ୍ତମାନ
जिद्दी
काई करछि अच्छा केते बयस पिला माने छुआर बयस केते
मैडम से 3 वर्ष 4 मास तार
अच्छा केते माने एबे कोन टाइम आपन करे केते केतेटा बाजछि सेठे राती 9टा साढ़े केतेटा बाज एबे 9टा बजथियो ना
9:13 PM
what is his
9:13
sleep time केते बेलको तार
तार स्लीप टाइम टा 10टा परे खाइ सारला परे 10टा परे
okay so first of all maybe ताको attention मिलनी आपण एटे बसचंती maybe you help him to sleep maybe that's one secondly जदी से माने जेबे भी जिद्दी करूची एटा जिद्दी नाही एटा बिहेवियर नाही तारो किछि गुटे नीड अछि भितरु is he potty trained से बाथरूम जाउची निजे ना आपण को देखिया पड़े
नहीं से बाहरे जाउची माने बाथरूम तो जाउनी एठी बाहरे जाउची बाहरे जाय गले सेटा को मैं नै कि ताको बाथरूम रे पके दउ
बट किंतु से कहंती से कह माने डज ही से कि मते जिबार छी बाथरूम को ना आपण जाबा पड़े
आज्ञा हां कहे गगी कहिले कहे
सो ए टाइम रे एज अ मदर मु एम्फसाइज करबी कि जदी 10टा को पिलाटा सोची 9टा भितर आपण बेडरूम रे से कोन टिके गीत फित लगे देबे कि किछि झूला थिबो झूला रे जो हमरो कपड़ा झूला मिलुची आपण कपड़ा झूला लगे कि ताकू बसई पारिबे सेटा रे टिके काम करिवे तापरे बेड रे सुआई कि ताकू गोटे कंथा रे रोल कर देबे ताकू प्रेशर देबे एक्सक्यूज मी ए सब जिनस कले ना से टिके काम डाउन हबो आ मु सबु मु जानछि इंडिया रे हमें राति रे छुआ मान को गाधेवा को माने हमें गाधाउनु किंतु तांको जदी आपण उषुम पानी रे टिके गोड़ हाथ पुछि देबे एउडा सब कले ना से तारो जो भितरु से सेंसेशन ता आछी सेडा टिके काम हे जिवो हाथ पापुली को घसी देबे हाथ पापुली आ पाद आ सब जॉइंट गुडा को एमती धरि कि टिके माने दीटा जॉइंट को एमती प्रेशर देबे दी हाथ रे धरि कि आपण जॉइंट को एमती प्रेशर देबे एटा कले कामिंग एटा सब बहुत कामिंग अगेन म्यूजिक बहुत बढ़िया लाइट ऑफ कर देबे से रूम लाइट कम कर देबे ऑफ करबे नहीं लाइट कम कर देबे गुटे ना डिसिप्लिन रखंतु किड्स विथ ऑटिज्म स्पेक्ट्रम दे सीक से मन को ना तांको दरकार गुटे सर्टेन डिसिप्लिन आ पूरा फैमिली सेटा फॉलो करंतु सर्टेन वे सर्टेन टाइम रे सोइबा सर्टेन टाइम रे टीवी देखिबा टीवी डिस्ट्रैक्शन एडा सब जा कम कर देबे सो एनवायरनमेंट टा को एम्ति कंड्यूसिव करिवे कि से छोटा सोइ पड़ियो बुझिबले so I think that's what it is maybe he's sleepy
thank you ma'am Babita ma'am aw gote hand raise aschi rajesh Goswami Madam Karo. Rajeshri Goswami Madam, please unmute and ask your question.
Thank you, madam. ମୁଁ CDPO ଚାଇଲ୍ଡ ଡେଭଲପମେଣ୍ଟ ପ୍ରୋଜେକ୍ଟ ଅଫିସର ଭାବେ କାମ କରୁଛି। ତ ମୁଁ ଏଇଭଳି ପିଲାମାନଙ୍କ ସଂସ୍ପର୍ଶରେ ଆସେ। ଆଉ ବହୁତ ବହୁତ ଧନ୍ୟବାଦ। ଆକ୍ଚୁଆଲି ମୋର କିଛି କ୍ୱେଶ୍ଚନ ନାହିଁ, କିନ୍ତୁ ଆଜିର ଡିସ୍କସନ ମତେ ବହୁତ ଭଲ ଲାଗିଲା। ଆଉ
Thank you.
many thanks to ବବିତା ମ୍ୟାଡାମ। ଆଉ
Thank
ମୁଁ
you.
ପ୍ରିଫର କରିବି ଆପଣଙ୍କ ସାଙ୍ଗେ ପୁଣି କେବେ ଇଣ୍ଟରାକ୍ସନ କରିବା ପାଇଁ ପର୍ସନାଲି।
Nischay. I really want to do something in Odisha, so this is a precursor to that. Nischay, jaha bhi mate apan mane order karantu, mu available.
ହଁ
I
ମ୍ୟାଡାମ,
I
ଥ୍ୟାଙ୍କ ୟୁ।
actually want to work in rural areas, jo kaile na Koraput mate gote research project karibar chi je eite gote je asthile speaker je kaile Koraput re adivasi mane community re kainki tankara honi kainki amara hochi. That is a huge research project which will help me with my panchabhuta treatment which I'm doing here. Seta validate mu kar paribi. I want to do that. So ଆପଣ ମାନଙ୍କୁ ମୁଁ ଯାହା ବି information ଆପଣ ମୋଠୁ ଆଦାୟ କରିପାରିବେ କରନ୍ତୁ please, and I'll love to share because it's a wonderful journey when the kids start doing good because ସେମାନେ ତ ଆମର future and I totally understand parents ମାନଙ୍କର concern.
Thank you also. Thank you to Sunil Babu also and Prita madam.
Thank you.
बहुत धन्यवाद समस्तंकु. Today all the participants who have patiently been here till now, whoever joined also previously and had to leave the session, maybe they would get to look at the video that would be uploaded very soon so that they can also take advantage of whatever discussions happen later. And thank you to Ms.Babita Patnaik for all these insightful inputs. बहुत helpful ହେଇଥିବ hopefully ସମସ୍ତଙ୍କ ପାଇଁ. Sunil Babu, please you can take over. I think
Sure. I mean, words are not enough to thank Babita Madam, the kind of presentation that she made today. So I'm so happy for that. And I should also thank Preeta Madam for making this happen. Actually, it is she who actually made the connection between Babita Patnaik Madam and kalingahistory. So she deserves a special thank you also. So thank you.
Most of it is my privilege to actually, no thanks needed. I call Babita Ma'am as Babita Didi, and I have been associated with her for some time now, and I totally admire what she has been doing and what she even plans to do in the future. So hopefully some in each of our place ame nijo jagare rahiki kemti ame amaro society pai, community pai, desha pai, jati pai, even amaro prithvi pai, just ame samaste, as we all sometimes Babita Didi and I discuss, ame samaste Shri Ram karo gunduchi musa bhaliya. Just nijor choto contribution is also like way big enough for everyone. So choto jinso will add up to a lot of things. It takes a village, right, Babita Didi?
Yes.
It takes a village to make this world better. Like as she was talking about neurodivergence, we have to first of all stop talking about this labeling kids as a certain thing. This neurodivergence, typical, these are the words for the future. Everyone is different, and we have to embrace all these differences and make this if we embrace everyone's differences, I feel that is the way the world will be a better place in the future. So thank you again.
So thank you, everyone. My special thanks to all the participants who joined today, especially the parents. So what I got to understand from Babita Madam's presentation is that the parents are the first therapist of the child. So let them be strengthened by today's presentation. So thank you, Babita Madam. Thank you, Preeta Madam. Thank you, all the participants. So tomorrow, this video is going to be uploaded in YouTube. And in case you have anything, you can also put in the comments box. I would request Babita Madam to kindly keep checking the comment section of our uploaded video for at least a week, so that if somebody has raised a question, you can directly answer to that question then and there. So thank you.
Yeah,
Good night.
I would like to And I would
Yeah,
like,
please,
yeah, I would
please,
like to
please.
end with a note. Ebe Preeta madam just कहले, and I have known Preeta for a while now, and आमे बहुत किछि discussion करू कि ओडिशा पाई कौन करिबा आमे जो NRIs माने बाहर अछु आमे बहुत connected आम roots मन का संगे, and I think one of the reason I have to say this, my dad Shri तांका ना Shri Ram Patnaik and my mother Urmila Patnaik, they are no more, but my dad always told me, झियो तू बाहर को जाउछु किंतु always remember तू कौन निजर देश पाई निजर state पाई तू कौन कर परियो. I think this is a huge opportunity now that has come to me through this platform to reach to my people. मु जो जगह belong करची मु गंजाम रु मो मदर को फैमिली पार्लाखेमुंडी रु आउ मो डैडी गंजाम रु थिले, so आस्का बोईरानी गंजाम ए सब मोर आ कोरापुट रे मोर मौसा रहिथिले, तो मु बहुत कनेक्टेड मु एबे रिसेंटली जाके आस्थिले ओडिसा. आमे जहा जो पेरेंट्स मान का संगरे भी बहुत रिलेटेड मु, because my son was in neonatal unit for 21 days, so I really know what the parents go through. Since I was a therapist I could manage, किंतु माँ मान को पाई बहुत difficult, and I want to be there as a coach. जमते सुनील बाबू कहले माँ माने parents माने they are the first therapist, and that's what we want to do. We want to empower them with the knowledge. We want them to have exercise regimes, and we want to have more discussions like this where we can tell amaro jo जिनसटा मु भूली जाइछे कहबाकू कि early intervention केमती करिवा. First person who would know, who would tell the parents is the person who is a neonatologist. जो NICU neonatal intensive care unit रे जो डॉक्टर्स माने काम करंती, तांको से माने फर्स्ट से माने देखंती पिला माने यूनिट रे अछंती, तो तांको से माने को कहवा कथा पेरेंट्स मान को प्लीज फॉलो अप विद अ डेवलपमेंटल थेरेपिस्ट और प्लीज फॉलो अप विद अ पीडियाट्रिक न्यूरोलॉजिस्ट. तो जेबे आपण को छुआ न्यूरोलॉजिस्ट पाखु जाउची सेतोळे ही आपण को सेई टाइम रे 2 मास मासे 2-3 मास डज नॉट मैटर. आपण सेतोळे कहबे ए पिलाटा को मु थेरेपी देबी, ताहले जाय कि पिलाटा को अर्ली इंटरवेंशन करे कि वी डोंट हैव टू डील विथ ऑल दिस डाउन द रोड. सो से जो अवेयरनेस हमको somehow we have to spread, we have to use the press, we have to use we have to educate the doctors and tell them please be proactive. You know, when we come back and sit down and wait for a kid to be 3-year-old, 5-year-old, 7-year-old, 21 years old, we can do things, but it gets limited. किंतु जदि आमे first through hit करिवा, it would be good. So I mean केते जिनसा अच्छी share करिया को. Again, I really need you know, to talk to the right people to get this information and awareness to. And I'm very, very thankful कि मते गोटे सुजोग मिलला. एते
Madam,
बहुत
I'm grateful to you that you have spoken so well on the topic and also talk to the parents. As a closing note, I would like to say the parents that let us stand with the child and understand that he is not a special child but a child to us, just like any other child who would have taken birth. We have to give him the protection. We have to give the protection from the aha and choo-choo of the neighbors, because very often we listen and that why kahinki tamoku hi kahinki hela, why this has happened to you only, you have not done anything bad to anybody, but why this child has come to you. It is not that. The child has come to you because you can stand with the child. That's why the child has come to you. So you are special. The child is not special. The child is a child who had to come to the earth, and because you are special, the child has come to you. So let us stand with the child. Let us be with the child. Let us protect the child. And despite of all the efforts that we put, that the child has to have his own true potential. If whatever the potential he has got, we have to aim for achieving that. But at the same time, whatever he achieves, that is his capacity, and that has to be accepted. That much he can do it. Let's not let us appreciate each and every little step that he progresses, or whatever he responds. Let us be proud of him because he is our child. Thank you again to all the parents that will connect together, and let us also support the institutions which are standing with the child. Thank you again. Namaskar.
Thank you, Santaka, for this crucial comment at the close of the session. And once again, thank you, Babita Madam. And since you have mentioned your parents, salutes to them for instilling this sense of serving the public cause. Thank you. Thank you. So good night, everyone. Namaskar.